and Medical Services of Fiji, Excellency Dr. Keunkwan, Commissioner of Statistics Korea, Excellency Dr. Sanong Thongsana, Deputy Minister of Health, Lao PDR, Excellency Dr. Dennis Mapa, Undersecretary, National Statistician and Civil Register of the Philippines, Excellency Dr. Pungky Sumadi, Deputy Minister for Population of Manpower, Bapanas, Indonesia, Excellencies, distinguished delegates, ladies and gentlemen, I'm delighted to welcome you to this Ministerial Roundtable on Pandemics, People and Preparedness, Ministerial Roundtable on Civil Registration and Vital Statistics, COVID-19 and Health. The pandemic has led to tremendous challenges and opportunities for CRVS systems, especially related to the recording of deaths, and calls for collective efforts to shape the future landscape of health information to support sustainable development. The most fundamental question is, how many people have actually died from COVID-19 cannot yet be answered in many countries in the region. Indeed, it may take some time before we know the answer, and in some countries we may never know. In particular, the most vulnerable and marginalized population, those often most at risk of COVID-19, may never have their deaths counted. A well-functioning CRVS system is necessary to provide an answer to this question. However, during a public health emergency, such as COVID-19, even a well-functioning CRVS system is faced with challenges of backlogs in death registration and diagnostic uncertainties. This roundtable will discuss country experiences in responding to the challenges caused by the pandemic, while recognizing that it has also presented an opportunity for CRVS system strengthening due to the attention now given to mortality statistics. Ministers will also be invited to discuss how to transform CRVS systems to ensure preparedness for the next health emergency or pandemic. I hope that all participants will find this discussion useful as we enter the second half of the Asia-Pacific CRVS decade. Given the scope of the challenges we are facing, there are countless issues that need addressing. I hope today's roundtable can provide us with some of these answers and real solutions to these problems. I'm delighted that we have such esteemed participation by ministers in this event, highlighting the importance accorded to CRVS, and I thank our moderator, Dr. Philip Setel, Vice President of Vital Strategies, for kindly agreeing to moderate this event. Excellencies, ladies and gentlemen, I'm confident this event will share valuable approaches and good practices on improving CRVS systems to be more resilient for future crises and pandemic, and encourage innovative ways to achieve this. I look forward to the rich discussion today. Thank you very much.
Honorable Excellencies, distinguished guests, welcome to the Ministerial Roundtable on Pandemics, People and Preparedness, a Ministerial Roundtable on Civil Registration and Vital Statistics, COVID-19 and Health. In this session, we will hear from an esteemed panel of ministers, from whom we will invite 2 rounds of comment, followed, time permitting, by a moderated discussion and a brief set of closing statements. My name is Philip Setel, and I direct the Civil Registration and Vital Statistics Program at Vital Strategies, an implementing partner in the Bloomberg Philanthropies Data for Health initiative, in which ESCAP is also a partner. I would now like to briefly introduce our panel of ministers, and then invite our first guest to present his remarks. I'm told this session cannot run over time, so I will respectfully request our panelists to please limit remarks to 3 minutes and closing statements to 1 to 2 minutes. With us today, we are honored to welcome Dr. Jamesu Tudravu, who is the Chief Medical Advisor of Fiji, and here to represent the Honourable Dr. Ifereimi Waqainabete, Ministry of Health and Medical Services of Fiji, who has had to attend to other urgent affairs. We're also joined by His Excellency Dr. Pungky Sumadi, Deputy Minister for Population and Manpower of Bappenas, Indonesia. Dr. Sumadi has a PhD in economics from the University of Illinois. He has held many senior positions in the Indonesian government, reaching his current role in 2017. We are pleased to welcome His Excellency Dr. Keunkwan, Commissioner Statistics Korea, Republic of Korea, also who has a PhD in economics, in his case from Stanford University. He previously worked as an academic for 35 years in both the US and the Republic of Korea, before recently taking up his role as the 18th Commissioner of Statistics Korea. We are joined by His Excellency Dr. Sanong Thongsana, Deputy Minister, Ministry of Health, Lao PDR. Dr. Thongsana oversees the Department of Hygiene and Health Promotion, Department of Communicable Disease Control, and Department of Health Care. He is a medical doctor, specializing in cardiology. Prior to his current post, he was director of Mitafab Hospital in Vientiane. His Excellency, to round out our panel, Dr. Claire Dennis Mapa, Undersecretary, National Statistician and Civil Registrar, Philippine Statistics Authority, the Philippines, also joins us. Dr. Mapa has a PhD in economics from the University of the Philippines. He previously served as Dean of the University of the Philippine School of Statistics, as well as President of the Philippine Statistics Association, taking up his current post in 2019. Welcome to such an excellent panel of esteemed ministers. The first question to which we have invited comment is as follows. How can we respond to the ongoing challenges posed by the pandemic while leveraging the spotlight on mortality statistics to ensure sustainable capacity strengthening? Again, we kindly ask our speakers to limit remarks to 3 minutes. And I will ask Dr. Tudravu if you would please start us off with your remarks.
The Honourable Moderator, distinguished members of this forum, Excellencies, ladies and gentlemen. I firstly bring salutations and well wishes from the Honourable Minister Dr. Ifereimi Waqainabete on this occasion. Allow me to begin by conveying Fiji's deepest condolences to all member states for losses you have suffered during this pandemic. Fiji has also suffered much from the pandemic, but one of our brightest light of hope was achieved 2 days ago when we reached 90% full vaccination against COVID-19 for our target population. The scale and impact of the COVID-19 pandemic also challenged the health support systems and processes such as health information management and civil registration. In Fiji, all births and deaths are registered. The processes of births and deaths faced obstacles during the pandemic and took time and effort to build into a seamless, facilitated process. During the pandemic, WHO had updated and released the specific ICD-10 coding for pandemic-related events. This was shared to our mortality data management unit, and awareness done for clinicians through training and during the daily morning briefing on mortalities. As a result, SOPs on mortality certification and data management were quickly developed and endorsed by our COVID-19 National Task Force on COVID-19 mortality to accommodate the pre-existing policies and streamline the processes. We established a specific process for COVID-19 mortality certification, which was initiated at the beginning of the pandemic with the forensics unit, private sectors, and other stakeholders to gain consensus and ensure that each case was attended to in an efficient manner. These ensured that delays were minimized in the processing of disease and the certification of the disease was organized around the testing of COVID-19, and there was sufficient verbal history to confirm causation of its deaths. Verbal autopsies came to the fore for us in the Ministry of Health, from conducting only a handful each year to hundreds in a span of less than 10 months. About 57 deaths in Fiji due to COVID-19 were outside the hospital with little medical history, and more than 80% died within 24 hours of admission into a hospital. We need to build capacity of the relevant health workforce to be able to effectively and efficiently conduct certification of deaths during a pandemic. In our response, a series of webinars were conducted, specifically targeting clinicians to help with their practice and adjust to new guidelines. A training on MCDC was facilitated by experts from the University of Queensland and the Australian Bureau of Statistics to support our teams. The pandemic also highlighted the need for integrated information systems that facilitate the sharing and protection of health information. For Fiji, we had established a system that facilitates laboratory testing and the release of results to patients. And there is a need to integrate this information system and other information systems developed as part of the pandemic response with existing health information system and statistic systems. Preparedness should include integrating relevant information systems for efficient sharing and processing of information that impact policies and decision making. I thank you, Mr. Moderator.
Thank you very much, Dr. Tudravu. May I please invite the Honourable Deputy Minister Sumadi from Indonesia to present your response to this first question. The floor is yours, sir.
Thank you very much, Mr. Setel. Excellencies, distinguished participants, ladies and gentlemen. In responding to the questions, actually, Indonesia have been having the regime of active reporting of their civil registration. People are expected to actively report any population-related activities. However, we have not reached people's response in doing so as expected. Especially during the pandemics, things get worse. Access to service centers is very limited. So what we have been doing in dealing with the situation of civil registration during this difficult pandemic situation, we have two approaches. First, digital transformation and innovation. So we have seen many local governments, such as in city of Yogyakarta and Pariaman, launch civil registry applications so that people can register birth, death, divorce, change of address, etc. People can print all documents except the ID card themselves. So it's a PDF file with special QR code for authentication. This initiative actually provides sometimes of difficulties by the central command of the Civil Registrations Office. However, the certain registration office, such as legalizing, may be temporarily delayed, but registration of birth, death, stillbirth, and recording of causes of death should continue as priority. So we have developed close collaboration as well with hospitals, health centers, to our COVID-19 Central Command, and the Center of Civil Registrations Office for doing the improvement of the accessibility of the people for the civil registration. And the innovation simplifies and improves the standard procedure of civil registration. The second approach that we introduced also, that especially in the areas where internet connection is still scarce, local governments assign certified community members as civil registrar. In the case of the region of Bantaeng, for example, or Bandar Maria and Lombok Islands, actually, this is actually the activities that we ask the local community members to actively approach each household to identify whether there are needs of civil registry activities that they can register. So actually, now we are in the process of making these initiatives into national policies in civil registration procedures. So discussions among cabinet members are actually ongoing, and hopefully within the next two semesters, we will be able to launch that kind of improvement in the policy. Thank you very much.
Thank you, Honourable Deputy Minister. May I please invite the Honourable Commissioner Ryu, Commissioner of Statistics Korea, Republic of Korea, to deliver his response to our first question.
I'm very glad to meet you all, even though it's online. The Korean government is producing comprehensive and timely vital statistics in collaboration with the local governments. In Korea, every resident's identity is registered in the electronic resident registration system, in which each individual is given a unique identification number. Korea's resident registration system was first implemented back in 1962. Births, deaths, marriages, and divorces, among other things, are recorded into the Supreme Court's electronic family relations registration system, and also into our COSTES Vital Statistics Survey system. Vital Statistics was first implemented back in 1970 in alignment with the family relations registration system, which itself was developed based on the resident registration system. Local governments began inputting the reported registration information into the vital statistics system in 1997. Cause of death statistics is also produced by acquiring death reports and death certificates through the Vital Statistics Survey system. During the COVID-19 period, COSTES provides provisional weekly death counts by gender, age, and region to identify the occurrence of excess deaths associated with this pandemic. In Korea, excess deaths associated with COVID-19 are not prominent except for quite aged people. In Korea, vital statistics was produced without disruption, even among COVID-19. This is attributed to the nation's vital statistics production system. A well-functioning vital statistics system is critical in performing impact analysis on causes of death and excess deaths in the event of a pandemic crisis. Additionally, advanced CRVS systems should be developed to this end. This highlights the need for collective efforts to be made by governments and international organizations to establish a sound CRVS system. Thank you.
Thank you, Honourable Commissioner. I would like now to invite Honourable Deputy Minister Thongsana, Lao PDR, to present remarks in respect to the first question. Thank you so much, Dr. Thongsana.
Thank you, Moderator, Mr. Philip Setel. Dr. Amanda Stelias, Alisjahbana, Executive Secretary of ESCAP, Excellency Ministers, Vice Minister, distinguished ladies and gentlemen, thank you for giving this opportunity to share our experience during this challenging time in relation to registration, birth, and death, and migration. Regarding the issue raised by Moderator, how can we respond to the ongoing challenges posed by the pandemic while leveraging spotlight on mortality statistics to ensure sustainable capacity strengthening? I would like to share our experience like this. While our PDR managed to contain wide-scale community transmission of COVID-19 for over a year, with the influx of returning migrant workers, we started seeing an upsurge of cases. This triggered the current outbreak, which we are yet to bring under control. Our first challenge here was not knowing how many Lao migrant workers were in neighboring countries and were likely to return to effectively plan our health intervention. Being a landlocked country, there is a lot of informal movement between boundaries, and registration movement is big. This is certainly a gap that was identified during the pandemic earlier this year. And COVID-19 pandemic should be seen as an opportunity for regional strengthening of better border control, including registration. Talking about birth and death registration in Lao PDR, the system still requires significant strengthening. While the registration system within villages through the family book is very strong, this information is yet to be used to its fullest potential to strengthen CRVS. In case of death, majority of deaths take place outside health facilities and mostly at home. Only around 7% of all deaths occur in health facilities, and even for this small proportion of deaths, we do not have reliable cause of death statistics. However, as we all know, as can reach community transmission level of COVID-19, it is essential to measure excessive mortality in the community for improved surveillance. This is indeed an opportune time for Ministry of Health to work more closely with the Ministry of Home Affairs to close these long existing gaps. As first step toward this, the Ministry of Health and Ministry of Home Affairs signed a data sharing agreement in March this year. Our village chief usually know when a death occurs within the community, and establishing a system to capture this vital information. This vital information is key, which the Lao Statistics Bureau is responsible for compiling the data through the village statistics, and will be linked to the registration system of the Ministry of Health and Ministry of Home Affairs in the future. We are now working towards establishing a responsive system to capture data on death right from the village level and have them share across an electronic platform across both ministries, starting from Vientiane capital. We are adopting a bottoms-up approach after years of making slow progress from a top to bottom approach to that notification. Ministries of Health are now working more closely with the communities they serve in order to enhance COVID-19 surveillance, and this should be seen as an opportunity to strengthen that notification and registration. In the case of births, nearly 55% of births were registered by Ministry of Home Affairs in 2020. However, over 70% of on births take place in health facility, and by sharing birth notification data from Ministry of Health to Ministry of Home Affairs, the births could all be registered. The two ministries, through the new MOU arrangement, are working toward this. Again, we have noted a significant increase in the number of births in healthcare facilities during the COVID-19 pandemic, and we do not have significant evidence to suggest if there was also an increase in home birth due to poorer accessibility, particularly during the lockdown. This is extremely important for the Ministry of Health to know to shape its strategy to increase access to maternal and child health, particularly into remote and hard to reach communities. The Ministry of Health is working toward, together with the Ministry of Home Affairs, again, to try and bridge the gap collectively. Thank you, Moderator.
Thank you so much. And to round out our first set of responses to question 1, may I please invite the Honourable Undersecretary Mapa of the Philippines to present. Thank you, sir.
Thank you, Philip. Excellencies, ladies and gentlemen, good morning. The pandemic challenged the Philippine Statistics Authority to generate real-time death statistics as this became a matter of urgency, and the Philippine Statistics Authority responded to this call. The data collected from our civil registry documents from the local civil registrar offices around the country was indispensable to the formulation of policies and decision-making. Upon the request of our National Planning Office, the National Economic Development Authority, and the Interagency Task Force on the Management of Emerging Infectious Diseases, the mechanism on the submission of daily updates of civil registry documents and data files began earnestly on May 22, 2020. Likewise, the submission of daily updates on counts of 2020 deaths by month of occurrence and by city or municipality based on the data files submitted by our provincial offices began a month after, in June 13, 2020 until September 23, 2020. It became a weekly submission from October 2, 2020 onwards. The timely release of the weekly updates on death statistics to our Ministry of Health was made possible with the intensified collaboration between the units of the Philippine Statistics Authority, supported by additional manpower and training provided to our technical staff, particularly on the right coding of causes of deaths. These are all inputs in the timely release of death statistics and very important in the monitoring of the COVID-19 mortality in our country. Putting in place a reporting mechanism for death statistics became a priority and at the same time a challenge in the interest of producing official data coming from the statistical authority of the country. With the proliferation of unofficial statistics coming from various sources, the National Statistics Office needs to keep up with the challenge of producing quality data. The vision is to go beyond producing the data as the current health crisis necessitates, but to continue an institutional partnership that will ensure that quality statistical data is generated regardless of pandemic or not. The vision goes even further with the goal of setting information technology enabled and seamless handling of data at the local level. Thank you very much.
Thank you, sir. That brings us to the end of the first set of remarks. The second question we have posed to our panel is as follows. What can governments and the international community do to productively transform CRVS systems to ensure preparedness for the next health emergency or pandemic, in particular for countries with the least capacity? Let's go around again now for remarks to this important matter. Dr. Tudravu, may I please invite you to take the floor?
Thank you, Mr. Moderator. The WHO 6 building blocks for health systems provides a framework for developing and transforming CRVS systems for the least developed countries. Partners in the international community can assist governments to digitalize the MCDC process for medical practitioners and other health workers who initiate the death certification process. This will help to improve efficiency in the registration and reduce the number of errors and challenges associated with paper-based documentation and certificates. Governments and state authorities can establish national MCDC policies that mandate the training of relevant health workers in medical causes of death classification as a component of undergraduate or postgraduate training in healthcare disciplines. This knowledge can then be further strengthened with additional courses of training when practitioners are out in their field of practice. Partners can assist health systems in establishing well-defined processes of information flow from the certification of death at the health department through to recording of deaths by health information systems, and ultimately to registration of deaths at the Ministry of Justice. This can be enhanced with the integration of appropriate health information systems vaccination registration systems, and BDM systems. This will greatly assist statisticians and epidemiologists in accurately analyzing the impact of the pandemic and produce credible information that guide policymakers. Partners and funders can assist least developed countries in targeting funding support towards establishing resilient information system and CRVS systems that can support the current roles and processes in a non-pandemic situation and can also step up in functionality in response to a pandemic. The resilience is not only in digital resilience, but also physical resilience to environmental factors. Our example in Fiji has been that we battled 4 devastating tropical cyclones in the midst of responding to the crippling health and non-health impact of the pandemic. Lastly, funders and partners can assist developing countries in extending and improving access to the population to health information and CRVS information they need. For example, a strengthened birth notification process that allows greater access to birth certificates for the people, and a death registration system that reliably registers all deaths and allow ready access to death certificates for their relatives. Funders and partners can also assist in establishing monitoring and evaluation processes that support the ongoing improvement of the death registration process. This will ensure that the population have access to the information that they need and no one is left behind. Thank you, Mr. Moderator.
Thank you, Dr. Tudravu. May I please now turn the floor over to Honourable Deputy Minister Sumadi of Indonesia. Dr. Sumadi, I believe you're on mute.
Excuse me. Thank you, Mr. Setel. Since the start of pandemics, the government of Indonesia launched an omnibus law that allows the government to deal with the pandemic. The law allows us to increase our deficit budget funding that previously limits our budget deficit up to 3% of our GDP. With this budget flexibility, we have been able to provide the necessary measures in dealing with the emergency situation. So we have refocused our budget that we have extremely limited fiscal space for civil registry in this instance. So this is the room of collaboration we have created with international community. So we ask them to participate and work with us. And then we also work with local governments on improving the access of civil registry and vital statistics services. We deployed our experts to the fields to really understand what is actually the current situation, what actually limit them to report the civil registry activities to the central government, central command. So the innovation I briefly described were some of the results. Governments share information of these initiatives to international development partners. And then we also need to understand the pros and cons of these initiatives and work on strategies for improvements. For example, how we register offline and upload the recorded data when internet connection is unavailable. How the central administrator verifies the data, etc. Then make good documents. So setting up knowledge sharing strategies, including training staff, so make them experience to the least developed countries, is actually one of the initiatives that I would propose. Thank you very much, Mr. Moderator.
Thank you, Dr. Sumadi. May we please turn now to Honorable Commissioner Ryu, Republic of Korea.
COVID-19 raises the need for the entire global community to share the lessons learned from the pandemic to prepare for future crises. In responding to the pandemic for the past 2 years, our core staff became keenly aware of the importance of providing relevant, and timely statistics on the basis of administrative data, engaging in inter-organizational cooperation and data sharing to this end, and establishing institutional and technical frameworks. Costa has announced data paradigm shifts in terms of value, production, and service to compile more data in a safer manner, to produce statistics without face-to-face contact, and to provide users with improved access to several statistics. To this end, COSTAT is developing a so-called K-statistics system to securely collect, link, and utilize statistical data from different governmental organizations using the latest encryption technology, together with resident, family, and business registers. As I said, Korea has already been producing vital statistics since 1970 based on birth, death, marriage, and divorce reports that are linked with the Supreme Court's family relations registration system. COSTAT is very willing to cooperate with the international community to share our years of experience, knowledge, and very willing to provide technical assistance. COSTAT has signed an MOU with the UNFPA to jointly respond to the issues of low fertility and aging society, and is currently assisting developing countries with capacity building for demographic statistics. This would serve as a channel through which COSTAT provides assistance in relation to CRVS. Of course, this would require discussion with UNFPA. Additionally, COSTAT is undertaking ODA projects to help developing countries with statistical capacity building. This could serve as another channel to support less developed countries in building their CRVS system. Thank you.
Thank you, Commissioner Ryu. May I now invite Honourable Deputy Minister Thongsana, Lao PDR, to take the floor.
Thank you, Mr. Setel, Moderator. Regarding the second issue raised by our moderator, I would like to share our opinion like this. Hence, we reiterate that birth, death, and migration registration data is fundamental for improved surveillance and for a better preparedness and response to health emergencies. We need to invest in technology to strengthen surveillance. We have seen so much of investment going into developing software applications for contact tracing and tracking population movement. However, it's a pity that we are still talking about tracking vital events such as births and deaths. We need to invite wisely such fundamental systems and leverage on technologies available and seamlessly share vital information across different stakeholders. COVID-19 pandemic has created opportunities for different stakeholders to work more closely together and to adopt a bottom-up approach to notification. For instance, through multi-sources surveillance initiatives, Ministerial of Health is now working and respond to Ministerial of Health is now working more closely with provincial, district, and village authorities to improve surveillance and respond to COVID-19 pandemic. And we are capitalizing on these new form links to improve notification and legislation. We request development partners to support us on this endeavor. Thank you for your kind attention.
Thank you, sir. And to finish up our second round of comments, may I invite Honourable Undersecretary Mapa of the Philippines to share thoughts.
Thank you. On the second issue raised, the importance of capacity building activities cannot be understated. Development partners are an excellent source of best practices and innovation through the sharing of expertise and experiences. In the case of the Philippine Statistics Authority collaborated and benefited with our engagement with the vital strategies and the University of Melbourne to improve the timeliness, completeness, and accuracy of vital statistics. Training on the analysis of causes of national deaths for action, or Anaconda, has been undertaken to improve the quality of our vital statistics data. Anaconda is a tool for checking the quality of mortality data through a step-by-step approach to enable users to quickly conduct a comprehensive review of the mortality levels and causes of death. This tool has already been institutionalized in our country since 2016 to check the quality of the causes of death data. Capacity building activities should not be limited to external resource persons. We can also utilize multi-sectoral capacity building even within the national context. In the Philippines, the Philippine Statistics Authority continues to partner with our Ministry of Health in conducting more trainings, seminars, and workshops to improve the quality of the causes of deaths and to reduce into half our baseline target of 0.9 on the ill-defined causes of registered deaths by the health facilities. There should also be efforts towards building the capacity of the partners, especially at the sub-national level, where most of our civil registration documents emanate. We can train our medical records officers and local health officers in the proper accomplishment of death certificates, including the causes of death certification and on the International Statistical Classification of Disease and Related Health Problems, or ICD-10. We can also ramp up the efforts to use ICT to address interoperability and to hasten transmission of documents, and crafting of citizen-centric policies and setting up satellite offices, especially in remote areas, to make civil registration services accessible and affordable. Thank you very much, Mr. Moderator.
Thank you very much, Honorable Secretary, for helping us wrap up the panelist statement portion of this session. Happily, we have time for some discussion. And let's take a few minutes to consider some of the issues that have been raised in the remarks that we have just heard. To get us rolling, I'd like to pose the following question and invite any of the panelists who wishes to do so to comment. One of the key issues that has come out is the role of technology and digitization in the establishment and improvement of CRVS systems capable of keeping up with the informational demands of an evolving health emergency. What advice would you provide to countries that are on the beginning stages of that journey of digitization to help them make the path perhaps a bit easier? I will open the floor, please, to anyone who wishes to make remarks.
Okay, let me make a few comments. To prepare CRVS VI system in a well-functioning way, faced with a crisis like COVID-19, I think basically we need two preparations. One is technological, so well-developed ICT infrastructure to facilitate fast and timely communications among different information sources. And the second is kind of legal institutional framework. If I repeat our Korea's experience, we have set up legal institutional framework back in 1962, quite early, such that every bus can be recorded into governmental CRVS system. That was the beginning of this legal framework. And the second is obviously information technology. So the mix of these two infrastructure is very important. One institutional, the other one is technological. And then to get benefit out of these two infrastructures, obviously we need training. We need people who can work in both aspects of these necessary conditions. And as I mentioned, Korea is quite willing to provide training and other assistance if needed. Thank you.
Thank you, sir. May I invite any of the other panelists to speak? Dr. Sumadi.
Yes, please. Thank you. Actually, what we have learned so far that actually we need to deploy IT experts during this critical situation to develop simple and easy to use CRVS application with low bandwidth technology, because Indonesia is very wide, especially in the eastern part of Indonesia. There are signal problems actually. So it is very helpful for them if we can use low band facilities to make them able to do whatever registration they need to do. And of course, the second one is develop a massive marketing strategy, socialization strategy to make people understand actually, hey, we can still have this kind of service even though we cannot go outside our house, for example, because of the limitation because of the pandemic. So this kind of things that actually we've been doing so far. And then I think this is very good if we can replicate it into all regions in Indonesia. So I think that's the Indonesian example that I can share with. Thank you.
Thank you, sir. Over to you, Undersecretary Mapa.
Thank you very much, Philip. 2 points that I'd like to add. The first one is, of course, the linkage of the ICT system from the local level, the local government units where the data, civil registration data emanates to national agencies like the National Statistics Office, the Philippine Statistics Authority in particular, that the reports this vital statistics. So the linkage of the system, so that the reporting of the raw data, the events would be seamless. So that is very important. And of course, that would create the problem because in the case of the Philippines, we have about more than 1,650 local government units. I think an important intervention is investment on this ICT information communication technology system to the local government units to minimize the inequality of this intervention. So we have to really support our local civil registrar, in the case of the Philippines, to upgrade the use of technology in reporting vital events. Thank you very much.
Thank you, sir. Are there further remarks on this question, or shall we move along? A second question that occurred to me listening to the presentations has to do with how central coordination and collaboration are to the success of civil registration and vital statistics work. And all of you have highlighted how in the context of the pandemic, it either fostered or strengthened the opportunities for that collaboration. I'd love to invite some reflection on your part about the importance of effective governance of CRVS systems to foster the kind of coordination and collaboration necessary to leave no one behind. Dr. Sumadi, would you like to start us off?
Yes, it is very fortunate that actually we had planned to have the population census in 2020. And it is actually our statistics office would like to go to the field to do the census. And then we understand that actually the work will be much better if we can use the CRVS data. So our administrative is used as the initial data set, and then we go to the field, check it out with the people, and then we analyze it, we clean it up, and then we send it back to the Civil Registry Central Command at the Ministry of Home Affairs. In that way, our civil registration is much improved, the quality of the data, the information, so we can do that. That helps us in tracking the development situations because of the of the pandemic incidents here. So that's actually the experience that I can share with. Thank you.
Thank you. We have time for one or two other brief reflections before we invite our closing remarks. Dr. Thongsana, please take the floor.
Yes, thank you, Mr. Moderator. I would like to share our experience in Laos PDR regarding the CRVS information. Actually, in Laos, CRVS belong to the responsible of two ministries between Ministry of Health and Ministry of Home Affairs. Ministry of Health responsible, like we have developed system like a district health information system to register death and birth in hospital, of course, in hospital. As I mentioned in my remark, that most of death and birth take place outside hospital. So the family books responsible by village head of village, responsible by Ministry of Home Affairs. So both ministry we have to cooperate, to integrate, to have more clear information regarding this. That's our request for international stakeholders to support us in developing the one system that we can develop the CRVS together. Thank you.
Thank you. And then briefly, I'd like to recognize Dr. Tudravu, followed by Undersecretary Mapa. And then we will invite our closing remarks.
Thank you, Moderator. In our experience in Fiji, collaboration through a whole of government approach was critical in addressing the needed response for COVID-19. So essentially, all of government agencies were involved in coming together and sharing resources, as well as sharing information, critical information that ensured that our response was succinct and attended to the needed actions on the ground. Not only the whole of government response, but it is also a whole of society. Very similar to the law of PDR experience. We, as I've stated before, more than 57% of our deaths occurred outside the hospital. And it went up to 80% when you included the first 24 hours of admission into the hospital. So there was a large amount of information that we needed to get that was outside the scope of the formal sources of information. Therein lies the success of the whole of society engagement, in which we were able to get information that we needed for the registration, not only in births, but also in deaths. Thank you, Moderator.
Thank you, sir. May I recognize, please, Undersecretary Mapa, and then briefly from Commissioner Ryu.
Yes, I absolutely agree with the importance of coordination during crisis. And during crisis, I think coordination through centralization is very important, because different information sources can be better communicated and better coordinated through central authority. That's my quick remark on your question.
Thank you so much. And Dr. Mapa, please.
Thank you, Philip. Reflections here, 3 points that I'd like to highlight. One, of course, the pandemic created opportunity for our agency, the Philippine Statistics Authority, to have an even stronger collaboration between the agency and our local civil registrar, those that are at the local government units that collects the information related to our CRVS system. This also provided us, this stronger collaboration provided us with opportunity to provide targeted capacity building intervention to our local civil registrar. That's the first one. The second one is that we have an interagency committee on CRVS at the national level. And this pandemic, because there are issues that will have to be addressed, there is now a strong working relationship, an even stronger working relationship among the members of our interagency committee. And the last one, which is, I think, a opportunity for future work related to CRVS. We have an integration. We are planning an integration of our CRVS system into our national identification system, a national ID that is also being implemented by the Philippine Statistics Authority. So I think these are opportunities that are available and we are working with here in the Philippines. Thank you very much.
Thank you for such valuable comments to all our esteemed excellencies. I would now like to take the opportunity to invite 1-minute closing statements from each of you, starting with Dr. Tudra. That will take us just to the end of the hour and next section. Thank you.
Thank you, Mr. Moderator. While the pandemic has been devastating, it is also a great teacher, and we stand to lose if we don't learn from these lessons. Digital information system and ICT are the way to go. Development partners can assist developing countries in transitioning from current paper-based information system to electronic systems that promote accuracy, security, reliability, and accessibility. In Fiji, digital health information systems on mobile platforms have been very useful and assisted us when we needed to decentralize health services to multiple response sites in the wake of community transmission of the disease, as well as run population-wide mass vaccination campaign for the COVID-19. Training and ongoing capacity building is critical in updating our practitioners in the developments and the new directions of response. We took great effort to train medical practitioners in differentiating COVID-19 related deaths from COVID-19 associated deaths, or simply deaths due to the virus and deaths with the virus, as this was a challenge in the death certification process. Lastly, and we've addressed this point prior, collaboration is important, as exemplified by the challenge that we had in the registration of deaths in Fiji of foreigners and non-permit holders. Large-scale disasters like a global pandemic demand a multi-sectoral and multi-stakeholder approach. This approach needs to be part of the preparedness plan and will ensure the efficient use of resources and successes for our program. I thank you, Moderator.
Thank you so much for your participation in our panel, Dr. Tudravu. Dr. Sumadi, may I please ask your closing remarks?
Thank you. We have heard examples, experience, realignment of strategies and innovation from our esteemed participants. And there are a lot of positive results as well as challenges we can learn from. With close collaboration with our international partners, in case of Indonesia, we have been working very closely with the government of Australia. We should be able to develop better strategies, including capacity building strategies in CRVS promotion. We need to analyze and adjust these interventions to our local situation and institutional condition. I believe with discussion like this, facilitated by UN ESCAP, thank you for the leadership of Ibu Armida Alisjahbana, we will be able to provide better CRVS services to our people. Thank you, Mr. Setel.
Thank you so much, Dr. Sumadi. May I please now invite Honorable Deputy Minister, Commissioner Ryu, please, to share your closing remarks with us.
Thank you, Dr. Setel, for moderating this session very smoothly. Today's session was truly meaningful. We were able to share wide-ranging ideas and insights on CRVS. This pandemic indeed wreaked havoc on us, but also made us realize the need for and importance of CRVS system. A well-established CRVS system plays an extremely essential role in identifying the impact of a crisis on demographic changes. There are prerequisites to be met, however, and these include the development of ICT equipment and infrastructure, interorganizational cooperation and data sharing, an institutional framework, and well-trained staffs. Korea has accumulated its own experience and know-how on CRVS over the years, and will commit to sharing this knowledge with the global community. Thank you very much.
Thank you so much, Commissioner Ryu. Thank you for your participation today. Now I would like to invite Deputy Minister Thongsana from Lao PDR to share closing remarks.
Thank you, Mr. Setel. Thank you for giving opportunity to share, to have a cross remark. I hope that the pandemic, COVID-19 pandemic, has consumed our resources, limited resources, but we have dedicated our effort to overcome the situation, not only in Laos, in other countries. Regarding CRVS, we have assumed that we need significant strengthening in our country. So the collaboration between Ministry of Health through provincial, district, and local level, and Ministry of Home Affairs, we have to integrated effort to strengthen the capacity for the CRVS activities. So for this issue, I also request the international partner and development partner to support us in this endeavors. Thank you for your attention.
Thank you so much, Dr. Thongsana. And to wrap us up, please, your remarks, respected Undersecretary Mapa.
Thank you. The COVID-19 pandemic has greatly impacted the existing CRBS mechanism of the National Statistics Offices. Notwithstanding the prevailing constraints, we must strive to achieve our vision for this CRBS decade, to have universal and responsive CRBS system facilitating the realization of all people's rights and supporting good governance, health, and development. Having this goal in mind, innovations and enhancements are done to make our services accessible and affordable to users. IT-enabled and digital CRBS has been the call of time, with transactions starting to go online. This helped broaden our reach and provided a secure alternative in this time of the pandemic. Learning from others' best practices has also been a proven approach to overcome the unique challenges to complement and supplement our system. Thus, we cannot downplay the significance of cooperation at the international and local levels. As CRBS is pandemic sensitive, long-term and a whole of society approach in planning is necessary to caution CRBS in the future. Let us take this opportunity to renew our pledge and commitment to get everyone in the picture and leave no one behind. Thank you very much, Philip.
Thank you so much, Undersecretary. And with those very inspiring remarks, let us thank the esteemed panelists, colleagues, and friends for this remarkable roundtable session. This concludes our discussion. We've heard a tremendous set of contributions from a diverse set of countries presenting important views on the intersection of pandemics, people, and preparedness. Let me take this opportunity finally to wish everyone a successful, productive, and as energizing a conference ahead as this roundtable has been, so that everyone, everywhere gets in the picture. Thank you so much, and good day.
Excellencies, distinguished delegates, the meeting is called to order. As indicated earlier during the opening of the senior official segment, the second Ministerial Conference on Civil Registration and Vital Statistics in Asia and the Pacific is primarily organized as a virtual meeting to ensure the safety and well-being of all delegates during the COVID-19 pandemic, as well as due to ongoing travel restrictions in many countries in the Asia-Pacific region. We therefore welcome participants joining us through the e-conferencing platform Kudo and participants who are joining us via YouTube. Before we move on, I would like to inform delegates that the draft report of the conference is available on the website of the conference and has been uploaded to Kudo. The draft report has also been sent by email to all participants. Thank you for your attention on these matters. Excellencies, distinguished delegates, will you please join me in welcoming our special guest this morning, Ms. Amina J. Mohammed, Deputy Secretary General of the United Nations, Ms. Armida Salsiah Alisjahbana, Undersecretary General of the United Nations and Executive Secretary of ESCAP, His Excellency, Police Lieutenant General Nathapit Snidvongs, Vice Minister, Ministry of Interior, Thailand, Ms. Mikiko Otani, Chairperson of the Committee on the Rights of the Child, and Ms. Gillian Triggs, Assistant Secretary General, Assistant High Commissioner for Protection, UNHCR. Excellencies, distinguished delegates, may I now request the Conference Room Officer to play a pre-recorded message from Deputy Secretary General, Ms. Amina J. Mohammed.
Excellencies, ladies and gentlemen, thank you for the opportunity to address the second Ministerial Conference on Civil Registration and Vital Statistics in Asia and the Pacific. Civil registration and vital statistics are key to improving people's lives and leaving no one behind. As enshrined in Article 6 of the Universal Declaration on Human Rights, everyone has the right to be recognized as a person before the law. A legal identity for all is central to delivering on the Sustainable Development Goals and building a safer, more peaceful and resilient world. Proof of legal identity can unlock access to essential services, education, healthcare, justice and banking. It helps governments plan for effective service delivery and people to exercise their rights to vote, marry and inherit. Legal identity is essential for a full and dignified life, but around the world an estimated 1 billion people live without it. They include a disproportionate number of women, children and vulnerable people, those in greatest need of targeted services and protection. The United Nations Legal Identity Agenda promotes a holistic approach from birth to death, linking legal identity and civil registration systems. This requires investing in safe and innovative technological solutions. It means investing in the capacities needed to ensure everyone is consulted because they matter. Today's conference is an important step towards civil registration systems that are universal and inclusive, leaving no one behind. I wish you all successful deliberations. Thank you.
I would like to thank Ms. Amina J. Mohammed for her opening remarks. I would now invite Ms. Armida Salsiah Alisjahbana, Undersecretary General of the United Nations and Executive Secretary of ESCAP, to deliver her opening remarks.
Excellency Police Lieutenant General Nathapit Sanitwong Na Ayutthaya, Vice Minister of Interior of Thailand, Ms. Mikiko Otani, Chair of the Committee on the Rights of the Child, Ms. Gillian Triggs, Assistant Secretary General and UNHCR Assistant High Commissioner for Protection, Excellencies, distinguished delegates, ladies and gentlemen, I'm honored to welcome you all to the second Ministerial Conference on Civil Registration and Vital Statistics in Asia and Pacific. We are meeting here today to celebrate the midpoint of the Asia and Pacific Civil Registration and Vital Statistics Decade. Universal Civil Registration Record is an essential source of data for vital statistics on births and deaths.
Governments require these statistics to design, implement, and monitor public policies. Therefore, by investing in CRVS, we could ensure the monitoring of progress on the 2030 Agenda for Sustainable Development. The COVID-19 crisis has unveiled systematic challenges while created untapped opportunities for CRVS systems. It was evident across our region that a public health emergency, such as COVID-19, could bring challenges to a well-functioning CRVS system, as the authorities had to ensure accurate and timely information reporting on death registration. During the past 18 months of COVID-19 pandemic, health information system and infrastructure could not always deal with their existing limited capacities to gather accurate information, especially among the most vulnerable and marginalized population. We need to work together to strengthen CRVS system in recording mortality statistics. I also wish to recognize that the Asia-Pacific region has made impressive progress towards universal civil registration since the beginning of the decade. Many countries are close to registering all births and deaths, while others are rapidly closing the gaps. Our member states are working tirelessly to advance on 3 goals of the decade, that is universal civil registration, the provision of legal documentation, and the production of vital statistics from civil registration. It is heartening to note that the progress in implementing the regional action framework has been made by our member states. A growing number of countries are addressing civil registration and vital statistics issues in a coordinated multi-sector manner, while facilitating action at the various levels of their national governance structure. In fact, this regional approach has provided impetus to focus on institutional reform and management system that could help shape adequate monitoring of the performance of civil registration and vital statistics system. We have yet to get everyone in the picture. During the last 3 days, senior officials had the opportunity to exchange views about their progress and challenges towards our shared regional vision of universal and responsive civil registration and vital statistics system. They also discussed recent development requiring the improvement of these systems, including the role of civil registration and vital statistics for achieving the 2030 Agenda for Sustainable Development, providing legal identity for all, and the COVID-19 recovery. Indeed, whilst the impact of COVID has been truly devastating, it has also demonstrated the importance of data and specifically on the number of deaths and their causes. The need for timely, accurate data used by policymakers and trusted by the public has never been clearer. I also recognize that the ministers from around the region have provided dedicated and forward-looking leadership during the first half of the decade by committing resources to building and improving their national civil registration and vital statistics system. We still need to maintain and in some cases redouble our joint efforts to accelerate progress to achieve universal civil registration at the end of the decade. Today, this ministerial conference is providing a dedicated platform to exchange perspectives and time-bound solutions for achieving our shared regional vision of universal and responsive civil registration and vital statistics system agreed upon in 2014. We are grateful for your commitment during the remainder of the decade. I count on your leadership and guidance. Thank you very much.
Thank you, Madam Executive Secretary. We have the honor to have His Excellency Police Lieutenant General Natapit Snidvong's Vice Minister, Ministry of Interior, Thailand, deliver his opening remarks through a pre-recorded message. May I now request the conference officer to play his video.
Deputy Secretary General Amina J. Mohammed, Executive Secretary of ESCAP, Armida, Salsiah, Alisjahbana, Ms. Gillian Triggs, UN Assistant Secretary General and UNHCR Assistant High Commissioner for Protection, Ms. Mikiko Utani, Chairperson of the Committee on the Rights of the Child, distinguished participants, ladies and gentlemen, it is my pleasure to welcome you to the second Ministerial Conference on Civil Registration and Vital Statistics in Asia and the Pacific. Although I wish we could all be in the same room, I'm still delighted to see our country's commitment to regional collaboration as highlighted by this conference you are attending online. I therefore would like to thank ESCAP and the co-organizers for the excellent collaboration in preparation for this event. I would also like to express my great appreciation to the ministers from all corners of Asia and the Pacific for your virtual presence despite the difference in time zones. Your Excellencies, ladies and gentlemen, in 2014, Thailand had the privilege to host the first ministerial conference on civil registration and vital statistics, during which we proclaim our shared vision that by 2024, all people in Asia and the Pacific will benefit from universal and responsive civil registration and vital statistics systems. It is therefore a pleasure for me to see the impressive progress made since 2014. As discussed during the senior official segment, much hard work has been put into improving civil registration and vital statistics systems in the region, whether digitizing systems or reviewing legislation or myriad other activities, and the results speak for themselves. The estimated number of children under 5 in Asia and the Pacific whose birth has never been registered fell from 135 million in 2012 to 64 million in 2019. The percentage of deaths which are registered is also improving, and data from civil registration is increasingly used for vital statistics, helping us monitor the achievement of the Sustainable Development Goals. Your Excellencies, ladies and gentlemen, despite this remarkable progress, we should not rest on our laurels. The COVID-19 pandemic has highlighted remaining gaps in our civil registration and vital statistics systems, especially with regard to mortality. If we do not register all deaths, how can we really know the true impact of the pandemic in Asia and the Pacific? Furthermore, our objective is to get everyone in the picture, and this means everyone. For this reason, we must ensure we redouble our efforts to include the most hard-to-reach and vulnerable populations. Consequently, I'm proud of the work we have accomplished in Thailand. Issuing birth certificates is one of the pledges that our Prime Minister announced at the 71st UN General Assembly and Summit for Refugees and Migrants. We therefore continue to meet and fulfill our responsibility in this regard. The Ministry of Interior and its agencies have rigorously carried out birth registration, in particular for displaced people and hard-to-reach communities living in border areas. We hope these efforts will help us achieve universal registration and fulfill our promise of leaving no one behind. Your Excellencies, ladies and gentlemen, the discussions that will take place today will shape the second half of the Asia and the Pacific Civil Registration and Vital Statistics decade. We shall thus provide clear guidance to help make sure we will achieve our shared regional vision of universal and responsive civil registration and vital statistics systems. Thank you very much for your attention.
Thank you to His Excellency. Now I have the honour to invite Ms. Mikiko Otani, Chairperson of the Committee on the Rights of the Child, to deliver her opening remarks.
I'd like to thank the organizers to invite me to address the second Ministerial Conference on Civil Registration and Vital Statistics in Asia Pacific. The theme is very important for the children's rights. The Convention on the Rights of the Child provides the right of the child to be registered immediately after birth, and all states in the Asia Pacific ratified the convention. This conference is very relevant not only in the regional framework of the Asia Pacific Civil Registration and Vital Statistics Decade, but also in the global context of the 2030 Agenda and its decade of action, more specifically as the SDG target 16.9 to provide legal identity for all, including free birth registrations. Birth registration of all the children is the international legal obligation of the states under the Convention on the Rights of the Child. But to be protected as children under the Convention, age matters, as children are defined as every human beings below the age of 18 years. Many special protection of children is linked to age, such as prohibition of child marriage, child labor, and recruitment and use in armed conflict, protection from sexual exploitation, special treatment as child in the justice system. To be given special protection as children, they need to prove they are children by birth certificate. To get birth certificate, children, first of all, need to be registered. Furthermore, birth registration is the basis for the protection and access to all the rights of children under the Convention, such as education, health, access to social and protective services from violence, alternative care. In this relation, I'd also like to emphasize the critical importance of the birth certificate. The committee has observed the progress of birth registration in many countries, and I congratulate the very successful progress in the Asia Pacific. However, obtaining the birth certificate remains a challenge. I'd like to appeal to you that free birth registration immediately after the birth and providing the birth certificate to all the children should be promoted and implemented together. Universal Declaration of Human Rights adopted in the UN General Assembly in 1948 proclaimed that all human beings are equal in dignity and rights. Everyone is entitled to all the rights and freedoms without any distinction of any kind, including birth or other states. But if human beings are not registered as human beings, this principle of non-discrimination doesn't mean anything. Thus, the declaration in Article 6 stated that everyone has a right to recognition everywhere as a person before the law, and in Article 7 stated that all as equal before the law and are entitled without any discrimination to equal protection of the law. Of course, the Convention on the Rights of the Child in Article 2 provides non-discrimination for children. To be protected from discrimination, all children need to be legally recognized as children, as human beings before the national law and before the Convention. Universal birth legislation provides this foundation. I thank you.
Thank you, Ms. Otani, for those opening remarks. Lastly, may I now invite Ms. Gillian Triggs, Assistant Secretary General, Assistant High Commissioner for Protection at UNHCR, to deliver her opening statements. May I please ask the Conference Officer to play her remarks.
Your Excellencies, ladies and gentlemen, it's a great honour for me to welcome you here today on behalf of the co-organisers of the Ministerial segment of the Second Ministerial Conference on Civil Registration and Vital Statistics in Asia and the Pacific. I'm confident that this conference will be an important milestone for the region's path towards universal and responsive civil registration and vital statistics systems, and that it will bring us all closer to the realization of the 2030 Agenda for Sustainable Development. Since the start of the Asia and Pacific CRVS decade in 2015, the region has made tremendous progress, but at the same time, certain gaps and inequalities persist. Hard-to-reach population groups and people in vulnerable situations face challenges when they try to get access to national registration. From the perspective of the United Nations Refugee Agency, one of the greatest challenges remains birth registration for refugee children and for stateless children. At the first ESCAP Ministerial Conference on CRVS in November 2014, the ministers pointed out that universal and responsive CRVS systems were critical to promoting durable solutions for refugees. This reflection is as pertinent today as it was back then, and it applies equally to voluntary returns, resettlement, alternative pathways such as education and labour, and the building of resilience in the local context. Birth registration in national mainstream systems remains the primary path to ensure that the legal and practical conditions for durable solutions are fulfilled. Therefore, it features prominently in UNHCR's protection strategies. And it's for this reason that UNHCR welcomes the ESCAP members' and associate members' commitment to remove all legal and practical barriers to birth registration. The relationship between birth registration and the prevention of statelessness is a further issue of particular concern to the UN Refugee Agency, and it's reflected in our Global Action Plan to end statelessness by 2024, an ambitious goal. In the Asia and Pacific region, the lack of birth registration, and as a consequence the lack of legal identity documentation, constitute a major risk factor for all stateless people. Birth certificates are instrumental for proving an entitlement to a specific nationality because they establish the child's parentage and place of birth. To prevent statelessness, birth registration remains of utmost importance, especially among marginalised, hard-to-reach population groups. The ESCAP members and associate members' shared vision of universal birth registration is therefore highly valued. Your Excellencies, ladies and gentlemen, for today's conference proceedings, I wish you a very successful conclusion of the agenda, including the adoption of the Ministerial Declaration. Thank you all very much for your attention.
Thank you to the Assistant High Commissioner. That now concludes the opening statements by our distinguished speakers. I would like to thank all Excellencies for an invigorating start to the ministerial segment. Excellencies, distinguished delegates, it is now my pleasure to conduct the election of officers for the ministerial segment of the Second Ministerial Conference on Civil Registration and Vital Statistics in Asia and the Pacific. In line with its rules of procedure, the conference will elect from among its members a chair and 2 vice chairs of the session. However, if the plenary so decides, the rules may be applied differently today for the Second Ministerial Conference on Civil Registration and Vital Statistics to accommodate the extraordinary circumstances of the COVID-19 pandemic and elect a chair and 1 vice chair of the session. May I seek nomination for the chair and vice chairs of the conference? The floor is now open for comments. I recognize the distinguished delegate of Georgia. You have the floor.
Thank you, Madam. We would like to propose as chair Dr. Faisal Sultan, Special Assistant to the Prime Minister on National Health Services, Regulations and Coordination from Pakistan, and as Vice Chair, Mr. Tumur Amarsana, Ambassador, Extraordinary and Plenipotentiary and Permanent Representative to ESCAP, Mongolia. Thank you.
Thank you, distinguished delegate of Georgia. Would any other delegation wish to propose alternative nominations or second the nomination just made? I recognize the distinguished delegate of Bhutan. You have the floor.
Good morning. I, on behalf of Bhutan, second the proposal and support and second the proposal of Georgia for the appointment of chairman and vice chairman of the Bureau of the Ministerial segment. Thank you very much.
Thank you, distinguished delegate of Bhutan. Would any other delegation wish to propose alternative nominations or second the nomination just made? I recognize the distinguished delegate of Malaysia. You have the floor.
Good morning. Thank you, Madam Chair. On behalf of Malaysia, I agree with the proposal proposed by Georgia and seconded by Bhutan.
Thank you, distinguished delegate of Malaysia. Would any other delegation wish to take the floor? I see none. I would like to thank Georgia for the proposal and Bhutan and Malaysia for supporting the proposal. I now declare that the following distinguished delegates to serve on the Bureau. As Chair, Dr. Faisal Sultan, Special Assistant to the Prime Minister on National Health Services, Regulations and Coordination, Pakistan. As Vice Chair, Mr. Tumor Amasana, Ambassador Extraordinary and Plenipotentiary and Permanent Representative to ESCAP, Mongolia. On behalf of all present, it is now my privilege to congratulate the elected members of the Bureau of the Ministerial segment and to extend very best wishes for success in today's important work. Excellencies, distinguished delegates, it is now my honor to invite His Excellency, Dr. Faisal Sultan, the Chair of the Ministerial segment of the Second Ministerial Conference on Civil Registration and Vital Statistics in Asia and the Pacific, to conduct the meeting from this point forward.
Excellencies, distinguished delegates, I would like to thank you all for the confidence placed in me to serve as your chair and the great honor that you have bestowed upon my country and on me. Together with the Honourable Vice Chair, I shall endeavour to do my very best to discharge the responsibilities of serving as your chair with the support of the ESCAP Secretariat. The members of the Bureau and I shall do our best to ensure that the Ministerial Conference on Civil Registration and Vital Statistics achieves its objectives and reaches a successful conclusion. We pledge to honor your trust by discharging our responsibilities with dedication, professional ethics, and principles that guide the international civil registration and vital statistics community. Excellencies, distinguished guests, we are convened here today at the midpoint of the civil registration and vital statistics decade in Asia and the Pacific, and to review the progress made thus far and to provide guidance for the second half of the decade to ensure that the achievement of the shared vision that by 2024, all people in Asia and the Pacific will benefit from universal responsive CRVS systems, facilitating the realization of their rights and supporting good governance, health, and development. The COVID-19 crisis has indeed underscored the need for accurate and timely registration of all deaths and emphasized the importance of vital statistics for an evidence-based policymaking and ensuring that every person has the legal identification needed to access public services. This ministerial conference provides an opportunity to identify and find common solutions to challenges faced by civil registration and vital statistics systems in the region, with consideration for the instrumental role that they play in achieving the goals and targets of the 2030 Agenda for Sustainable Development. Distinguished delegates, important deliberations are ahead of us. I'm mindful that as chair of the conference, it is incumbent upon me to do my best to ensure that this session generates concrete commitments that shape the second half of the civil registration and vital statistics decade in Asia and the Pacific. For this, I rely on the cooperation and active engagement of all distinguished delegates and the able support of the members of the Bureau.
I'd like to invite the Chair to move on to the adoption of the agenda.
Thank you. Excellencies, distinguished delegates, let us now turn to agenda item 1C on adoption of the agenda as presented to you in the document ESCAP MCC RVS 2021 L1. I now invite any comments on the agenda from the floor. Since we have none that I can see, the provisional agenda as contained in the document ESCAP MCC RVS 2021 L1 is adopted. Excellencies, distinguished delegates, this concludes agenda item 9. I will move on. Unfortunately, due to the current COVID-19 situation and travel restrictions, I'm unable to be in Bangkok to take part in this important conference in person. And given the challenges due to technology limitations for this virtual event, to ensure that the meeting is conducted smoothly, I would like to request that His Excellency Mr. Tamur Amarsana, Ambassador Extraordinary and Plenipotentiary and Permanent Representative from Mongolia to ESCAP, to moderate the sessions from this point onwards. However, before I hand over the moderation to Excellency Tamur Amarsana, I would like to make a statement in Agenda 10 towards a shared vision of universal and responsive civil registration and vital statistic systems that facilitate the realization of rights and support, good governance, and health and development. I will also take this opportunity now to present my country statement from Pakistan. I'm pleased to be taking part in this second ministerial conference on CRVS entitled Building a More Resilient Feature with Inclusive Civil Registration and Vital Statistics. No doubt, it is a fundamental principle of human rights that every life counts and every individual matters. And according to the Pakistan Demographic and Health Survey of 2017-18, only 42% of births of children under the age of 5 years are registered. Similarly, less than 5% of deaths are registered in the country. Knowing the global importance of CRVS for the country's effective economic, social, and health policies, Pakistan aims to enhance the capacity of national and local civil registries to deliver services in all segments of the country. Also, Pakistan is fully aware that to track progress on the SDGs, there is an urgent need for reliable, continuous, and comparable vital statistics. The government of Pakistan, Ministry of Planning, Development, and Special Initiatives, has been striving for the strengthening of civil registration and vital stats in the country. Since then, a number of steps have been taken towards this end, including rapid and comprehensive national assessments, formulation of high-powered national and provincial CRVS steering committees, in-depth assessment of multiple CRVS thematic areas, including legal framework, registration practices and coverage, birth and death registrations, migration, and use of ICT for CRVS, etc. During mid-2017, a technical support unit was created to play a catalytic and leadership role in CRVS promotion. Provincial governments are also in the process of developing such units for accelerating the CRVS process. Balochistan province, being the pioneer in developing such coordination and institutional mechanisms, initially the TSU was operating completely through donor support, but in 2020, a long-term program was approved for strengthening CRVS in Pakistan and transforming the Islamabad Capital Territory into a model CRVS district. Currently, the pilot project has been started, and the provinces are also in the process of developing their own long-term programs. In October 2020, a framework for vital events registration reforms was developed and was endorsed by the high-powered National Steering Committee for CRVS. Prior to this, approval, an extensive consensus building process was pursued where a large number of national, provincial, and international stakeholders were consulted to get their valuable inputs. The strategic plan for national CRVS and the development of investment case is also under the process of development and will be soon in its final form. Mainstreaming of the health sector in the CRVS system of Pakistan is a major policy action agenda, and the initiative has been taken for the first time under the Bloomberg Data for Health, B4H, initiative to strengthen the health sector in terms of standardized processes, formats, rules, SOPs, or guidelines. However, due to fragmented and sketchy laws available, there is a dire need for a comprehensive law. In this context, a process has been initiated to draft a comprehensive CRVS Reforms Act. Pakistan is receiving donor support from UN agencies, including UNICEF, UNFPA, UNHCR, and ESCAP, the World Bank, and vital strategies in the form of technical assistance, capacity building, application of information and communication technology, and the exchange of knowledge. However, further support will help the replication of activities across the country and an exchange of knowledge and best practices in the region, as it has a key role to realize the shared vision of acceleration and enhancement of CRVS in Pakistan. In conformity with the Regional Action Framework, Pakistan, through its national focal point, has been sharing its progress on development for CRVS promotion. However, regardless of all the efforts, the results of CRVS decade in baseline and midterm have not been promising with the targets in most countries of the ESCAP region. Therefore, it is suggested that the CRVS decade should be extended to 2030. ESCAP countries are fortunate enough to have partners who are willing to support this cause. However, to make the utilization of funds more effective, there should be a multi-donor trust fund where every partner should pool their funds, and such funds made available according to the strategic plan formulated by member countries. The government of Pakistan is fully alive to the significance of CRVS and relationship to planning and decision-making process. CRVS improvement is also very well reflected under Pakistan CRVS Vision 2030 and the National 5-Year Plan. We will pull all efforts to promote registration of vital events and generation of meaningful statistics, serving as evidence to monitor development progress against global benchmarks such as the SDGs. Thank you very much for your kind attention.
Thank you, Excellency. It's my honor to accept your request and take this role. Thank you, Secretariat, Excellencies, distinguished delegates. Agenda item 10, towards and shared vision of universal and responsive civil registration and vital statistics systems that facilitate the realization of rights and support good governance, health, and development is presented to you in 4 regular documents. ESCAP/MCCRVS/2021/1, summary of getting everyone in the picture, a snapshot of progress midway through the Asian Pacific Civil Registration and Vital Statistics decade. ESCAP/MCCRVS/2021/2, support from development partners in the first half of the Asian Pacific Civil Registration and Vital Statistics decade from 2015 till 2024. ESCAP/MCCRVS/2021/3, the potential of the health sector to catalyze accelerated improvement in civil registration and vital statistics. ESCAP/MCCRVS/2021/5, vital statistics production, dissemination, and usage, harnessing civil registration data for decision making, and 2 information documents. These papers are listed in the annotated agenda. May I remind all delegates that these papers are provided for noting only. Can I now invite Mr. Zahedi, Deputy Executive Secretary of the ESCAP, to introduce agenda item 10. Mr. Zahedi, the floor is yours.
Thank you very much, Your Excellency. Good morning. Distinguished delegates, it is my great pleasure to present to you the background for this session entitled Towards a Shared Vision of Universal and Responsive Civil Registration Systems that Facilitate the Realization of Rights and Support Good Governance, Health and Development. I will be sharing with you some of the key findings from a review of progress towards the goals and targets of the Regional Action Framework on Civil Registration and Vital Statistics conducted at the midpoint of the decade. The presentation will also touch upon some of the main findings from the formal documents, focusing on both the support from development partners as well as the potential of the health sector to strengthen civil registration and vital statistics systems. Starting with progress. The review shows some really positive progress, starting with birth and death registration and the goal of universal registration. We can see that the region has advanced considerably since the beginning of the decade. We are on track to meeting the targets, which really is a noteworthy accomplishment. But of course, we are not there yet, and the momentum needs to be maintained across the region. We're all very well aware that registered births is particularly important, and the foundation of a person's legal identity, associated rights, and access to key services such as education and healthcare. So it has rightly been the focus of work in many countries since the beginning of the decade, really as a critical step to leaving no one behind. The efforts of countries are actually paying off, with many seeing significant increases in their registration completeness. The chart on the screen shows progress in the percentage of births that were registered between the beginning of the decade in 2014 and the midterm in 2018. As you can see, countries in East and Northeast Asia and North and Central Asia had already achieved high completeness at the beginning of the decade. But many countries in South and Southwest Asia, Southeast Asia and the Pacific started at a lower basis, but have since seen much faster progress, reducing the gap in birth registration. Moving on to death registration. The completeness of death registration is lower than for births in most of our countries. It is, however, very important for families and for government, since it retires a person's legal identity and can, of course, be used for mortality measures. Still, most countries are seeing increases, as the chart on your screens shows, including significant progress in countries like Samoa, Cambodia, Laos PDR, and Bangladesh. Despite these achievements, many countries will need sustained focus on death registration to ensure that the target is ultimately met. I'm also very pleased to report that we have already achieved 2 of the targets of the Regional Action Framework. First, when births and deaths are registered, a certificate is almost always automatically delivered free of cost. Second, the region has also achieved its target on the recording of causes of deaths occurring in hospitals. These achievements are notable successes to be celebrated and bode well for the second half of the decade. In terms of the second half of the decade, in the report, we have also identified some key areas for action that countries should prioritize in this second half. First, little is known about inequalities in access to registration. In other words, who is not being registered and who is frankly being left behind. Second, the production of vital statistics is lagging. Countries need to do a better job in delivering vital statistics from civil registration, really the best source of data when the system is well functioning. And third of all, countries that have a robust civil registration system should consider using it as the foundation for legal identity management. Civil registration as a basis for legal identity and identity management systems can result in greater inclusion and enable badly needed access to services. Which brings me to the support from development partners. Development partners have contributed actively to all of these efforts and the efforts of our countries to realize the shared vision of universal civil registration systems. For example, partners have established regional and thematic groupings to ensure a coordinated approach and maximize their impact. And they have provided support across the whole gamut of activities relevant to civil registration and vital statistics, such as on birth and death registration, vital statistics, legal identity, or digitization, in line with each country's needs. We are very grateful to partners, and we're delighted that they remain fully engaged to continue providing this support during the second half of the decade to help countries achieve their goals and their targets. The health sector is another area with great potential, may be seen more clearly now with the COVID pandemic than ever before. Reinforcing the links between the civil registration and the health sector can, of course, catalyze improvements of civil registration systems in many countries across our region. Throughout their lives, especially at times of births and deaths, people have contact with health professionals who are usually trusted by the communities they serve, placing them in an ideal position to help with the recording of vital events, especially when civil registration systems are weak. The health sector is also essential in the recording of causes of death through the collection of medical certificates of these causes of death for those deaths that are attended to by medical personnel, and through the conduct of verbal autopsies for deaths occurring outside of our health facilities. We hope that the presentation that I've just been through has provided a decent overview of Agenda Item 10 on shared vision of universal and responsive civil registration systems that facilitate the realization of rights and support good governance, health, and development. During this presentation, or during this agenda item, I should say, we are also honored to have two exceptional speakers, Mr. Michael Bloomberg, founder of Bloomberg Philanthropies, and Dr. Samira Asma, Assistant Director General of the World Health Organization. After their videos, we will then move to the country statements. Esteemed Chair, based on the findings presented and the discussions under this agenda item 10, the conference can provide insights on the process achieved so far in meeting the commitments of the Regional Action Framework on Civil Registration and Vital Statistics in Asia and the Pacific. And the conference may also wish to make further commitments to facilitate progress through the second half of the Asian and Pacific Civil Registration and Vital Statistics decade. With that presentation, esteemed Chair, I hand back to you.
Thank you, Mr. Zahedi. Excellencies, distinguished delegates, it's my pleasure to invite our special guests, Mr. Michael Bloomberg, co-founder of the Bloomberg Philanthropies Data for Health Initiative, and Dr. Samira Asma, Assistant Director General of World Health Organization, to provide us with insight on the progress achieved so far in meeting the commitments contained in the Regional Action Framework, and discuss on how to enhance collaboration between the civil registration authorities and the health sector, harnessing high-quality vital statistics for public policy and protecting the rights of everyone to be registered and have access to official documentation at all times, including during disasters, pandemics, and other crises. May I request the conference room officer to play the pre-recorded video of Mr. Michael Bloomberg.
Hello, everyone. During my 12 years in New York City Hall, we had a saying, "In God we trust, everyone else bring data." That idea also drives our company, Bloomberg LP, and our foundation, Bloomberg Philanthropies. Data helps leaders better understand the problems they face and how to solve them. Over the past 2 years, the pandemic has highlighted just how critical following the data is. We know that when most people die, there is no death certificate and no cause of death is recorded. At the same time, only 40% of births are registered. And as you know, that means governments are often forced to make critical policy decisions and allocate scarce resources without good information. We started the Data for Health initiative in 2015 to help governments improve their collection of health data, and while also helping them use it to inform their policy making. Over time, we've seen that there is a direct correlation between collecting this data and the ability to save and improve lives. So I want to thank you for your leadership in saving lives in your own countries by embracing this important issue. Keep up the great work, and all the best.
Thank you, Mr. Blumberg. May I request the conference room officer to play their pre-recorded video of Dr. Samira Asma.
Excellencies, honorable ministers, distinguished government representatives, dear partners and colleagues. On behalf of Dr. Tedros and the World Health Organization, I would like to thank the Economic and Social Commission for Asia and the Pacific for hosting this very important ministerial conference on civil registration and vital statistics. This conference, presided over by leaders, comes at a critical time. These past 2 years have been a tragic reminder of our inability to accurately count the human lives we lost during COVID-19 pandemic. There is no excuse for this. These inaccuracies have costed us immeasurable losses and led to ineffective allocations of our limited resources, including vaccines. To put this in perspective, WHO estimated 1.2 million excess deaths attributed to COVID pandemic in 2020 than officially reported. New excess death estimates will be released in December for all countries. And I'm afraid these excess deaths will be many times higher than the official reports. Health systems in every country has been tested. No country was prepared. For us to be better prepared, respond, and recover, we must invest in civil registration and vital statistics today so that every country has a robust health information system in the future. This is possible. We have all the tools and we know where the gaps are. Globally, 40% of deaths go unregistered, and about 155 countries do not have good quality cause of death data. Therefore, we must act together with a deep sense of urgency and responsibility to better support countries. We truly need to inject investments and innovation into CRVS, and there are important reasons for us to do so. Let me mention just 3. 1. Strong CRVS systems are vital to track progress towards Sustainable Development Goals. 67 of the 234 SDG indicators rely on CRVS data. Second, strong CRVS benefits both governments and the populations the governments serve. Without documentation, people become invisible and lose access to essential services, and governments cannot channel resources to provide these essential services. In short, strong CRVS systems are the backbone of health and a vital indicator of good governance. Colleagues, as we enter the decade of action to reach the Sustainable Development Goals by 2030, CRVS should be a top priority for us all. We just cannot afford to repeat the shortfalls of the past. We need more ambitious investments to scale improvements in CRVS at speed. We can leverage the digital solutions that are already being used in many countries to accelerate improvements. We also need a more ambitious goal. We need a clarion call. I challenge us all, can we agree at this conference to achieve 75% complete births, deaths, and causes of death registration by 2025 and deliver on CRVS by 2030? In short, 75 by 25 and deliver by 2030. I firmly believe we can, but we cannot achieve this without the health sector and partners present here today. Despite the setbacks, we have many reasons to be optimistic. Under the leadership of Dr. Tedros, WHO has made CRVS a top priority, and we remain committed to collaborate and support member states so that we literally and figuratively count everyone, because everyone counts. Thank you so very much for having WHO represent here today.
Thank you, Dr. Asma. Now, before we move on to the country deliberations, I would like to reiterate the ground rules for our discussions of this agenda item, as well as all other agenda items for today. We would like to ask for your support to tailor your interventions mainly to issues for discussions on actions only, and to keep your interventions not more than 3 minutes. I strongly urge delegations to keep interventions brief and focused. The timer has been set to assist you. You will be alerted when 3 minutes are up and will be asked to wrap up your interventions immediately. Given the technical limitations of conducting the conference through a virtual platform and in view of the mandates and operational requirements of the intergovernmental meeting, priority will be given to the members, associate members, and permanent observers of the Commission to deliberate on procedural matters. Limited opportunities to deliberate on procedural matters will be available for observer organizations, intergovernmental organizations, and other entities, depending on availability of time. Thank you for your attention. To maintain order and for delegations to be ready to take the floor, when I call on the speaker, I will also announce the delegation next in line. So I now invite any comments on agenda item 10 from the floor. The first speaker is Honourable Leota Setel, CEO, Minister of Samoa, Bureau of Statistics, and the Ministry of Women, Community and Social Development of Samoa, to be followed by Honourable Ahmed Nassim, Minister of Health of Maldives. You have the floor, sir.
Honourable Ministers, distinguished delegates, ladies and gentlemen, I extend warm greetings from the government and people of Samoa on this occasion of the second Ministerial Conference on Civil Registration and Vital Statistics for Asia and the Pacific. First, I express my sincere gratitude for the messages of sympathy and kind sentiments shared on the untimely passing of our dear colleague and government statistician, Ali Mua Malaifono Tawa Fa'asalaina. She has been a stalwart leader for our Bureau and a hard-working public servant that has for more than 30 years contributed to providing relevant quality statistics to support informed decisions to better the lives of the people of Samoa and the region. Excellencies, I am honored to address this high-level forum for the first time as Minister for our Bureau of Statistics. The challenges of the global pandemic have not hindered our resolve to ensure that equally important issues of development for the region, in particular statistics, are not neglected. I commend the continuous efforts of the Secretariat and members to convene this meeting. Samoa reaffirms its commitment to achieve the sustainable goals by 2030. As reported in our last SDG report, Samoa's monitoring and data management systems and capacities have improved with significant investment in the Samoa Bureau of Statistics. Multiple censuses and surveys undertaken over the past 10 years have yielded a wealth of socio-economic data critical for policy making and accountability purposes. Statistics is vital to improve decision making that is transformational if applied accurately to ensure no one is left behind. Critical to our work, especially the SDG 16, is providing the legal identity for all, including birth registration and complete universal registration through close collaboration with key stakeholders. Samoa was able to conduct its mass registration campaign, a first of its kind, which was pivotal to boosting registration of vital events. Finally, despite the impacts of COVID-19 on the provision of civil registration services and the capacity of governments to compile vital statistics, there are some potential positive outcomes. One, increased attention to mortality statistics for monitoring the pandemic impact. Two, enhanced data management through digitization. Three, improved intersectoral collaboration in vital event notification. Four, improved community awareness of CRVS. It is likely that these positive outcomes will help catalyze the development of national CRVS systems to provide these essential public services, as well as meet the data requirements for planning and monitoring human development programs. Samoa acknowledges the contribution of our development partners, in particular UNICEF, in our ongoing efforts. Our government has commended its National Identification Project through the support from the World Bank, where CRVS is the building foundation. The National Identification will support access to essential services, including health, improved implementation of our social protection policy, and inform accurate solutions and intervention that address the needs of the people, especially the vulnerable groups. These efforts will also inform our Build Back Better initiatives in response to COVID-19. Excellencies, Samoa commits to our collective vision for universal and responsive civil registration and vital statistics systems that facilitates the realization of rights and support good governance, health, and sustainable development. We encourage enhanced cooperation amongst our member states so we can advance efforts for implementation of the 2030 Agenda to ensure no one is left behind. Thank you, Soifua.
Thank you, Honourable Leotalamo Setel Lakisio, Minister for Samoa Bureau of Statistics and the Ministry of Women, Community and Social Development. Next on my list is Honourable Ahmed Nassim, Minister of Health, Maldives, to be followed by His Excellency Mr. Mak Mokoroa, Minister of Justice of the Cook Island. You have the floor, sir.
Assalamu alaikum. Good morning, Excellencies and delegates. Let me begin by expressing my sincere appreciation to the Economic and Social Council for Asia and the Pacific for extending this invitation to the Republic of Maldives to participate in this very important multilateral conference. This platform has provided us with the opportunities to exchange creative ideas it allowed us to engage in important dialogue across borders with one goal in mind, working towards a shared vision of a universal and responsive civil registration and vital statistics system in this region. Bodies have always maintained that civil registration is a basic human right, and in conjecture to that belief, normalized the use of a unique national identifier for each citizen that allows them to access essential services such as education, travel and banking within the country without any hassle. This introduction of the Social Health Insurance Scheme in 2012 further strengthened the reliance on this unique identifier. Having a valid national identity card is a prerequisite for accessing healthcare under this scheme. Consequently, this led to additional improvements in timely birth registration and issuance of national identity cards. Similar to births, we acknowledge the importance of timely death registration as well, and this has a direct impact on how the next of kin is able to manage financial and family affairs of the person who has passed away. Accordingly, this led to the implementation of the National Death Registration Policy with the enactment of the 1992 Vital Registration legislation, which made it mandatory to have a valid death certificate to perform the burial process. Post-enactment, the Maldives Statistics Bureau noted a significant rise in death registrations across the Maldives. Additionally, we recognize the need for our health sector to be more proactive in engaging with relevant stakeholders when working towards improving coverage of national birth and death registration. One such example is the revised birth and death registration bill, which is the result of multi-sectoral collaborative effort. This revised bill is built on lessons learned over the past 3 decades and addresses critical gaps identified through intersectoral dialogue over a long and dedicated period of time. I am pleased to note that the bill has been submitted to the Parliament for debate. Furthermore, it is important to highlight that the Ministry of Health is committed to playing a key role in generating timely vital statistics to track and publish all-cause mortalities across the country. Even during the peak of the COVID pandemic here in Maldives, the team dedicated to health statistics and information within the ministry worked with relevant parties to ensure that there was no disruption in updating birth and death records in the national system. However, we must not ignore the challenges we faced during the pandemic and continue to face even today when ensuring the quality of the cause of death information generated through the medical certification processes. To conclude, my deepest gratitude goes to our partner agencies for the support given to the police in the civil registration and vital statistics system. It is crucial that this support continues as small and developing states such as the Maldives require further assistance in streamlining our CRVS system and improve the quality of information generated, especially in relation to the cause of deaths across the country. On that note, I look forward to working with our partners and countries as we move towards achieving a shared mission. Thank you very much.
Thank you, Honourable Ahmed Nazim, Minister of Health, Maldives, for your statement. Next on my list is His Excellency Mr. Makoroa, Minister of Justice of Cook Island, to be followed by His Excellency Mr. Tazul Islam, Member of Parliament, Honourable Minister of the Ministry of Local Government, Rural Development and Cooperatives. His Excellency Mr. Makoroa, you have the floor, sir.
Honourable Ministers and senior officials, distinguished delegates, Kirana, and a warm greetings from the Cook Islands. As Minister of Justice, I want to thank the organisers of this conference for allowing me to speak briefly on the Cook Islands. Our Ministry of Justice administers our national registries for births, deaths, and marriages, pursuant to legislation enacted in 1973. Now, for many years, the Cook Islands has had a high success rate at having birth registered. Certain incentives assist in assuring birth registration are done, including a newborn allowance lump sum payment and a child benefit with payments twice a month until the child reaches the age of 16. Registration of the child's birth is essential in obtaining these payments. Despite this success, the Ministry of Justice is exploring several initiatives, including 1, modernizing our 1973 legislation that governs births, deaths, and marriages. 2, exploring the implementation of national IDs. And 3, moving towards a more digital environment. Fortunately, the impact of COVID-19 has not significantly affected the administration of our births, deaths, and marriage registries. Lesser marriage licenses have been issued compared to before the pandemic started, and there has been a greater use of communication technology. Now, the Cook Islands closed its borders in March 2020 and was declared a COVID-19 free zone the following month. Repatriation flights were arranged and travel were restricted until one-way quarantine-free travel to New Zealand opened in January 2021. Full quarantine-free travel between New Zealand and Cook Islands began in May 2021, along with a vaccination rollout. Travel was suspended again in August 2021, and vaccines for children 12 to 15 years of age was rolled out in October. As of 30th October 2021, approximately 99% of our eligible population has been vaccinated with a first dose and approximately 93% vaccinated with a second dose. Now, with great success in rolling out vaccinations, the Cook Islands is now going to reopen two-way quarantine-free travel between the Cook Islands and New Zealand beginning 13 January 2022, provided intended travelers meet criteria such as being double vaccinated and provided a negative COVID-19 test prior to travel. It is my hope that as we all push forward and meet the challenges before us, we will increase our opportunities for collaboration and success. Now, on behalf of the Cook Islands, I wish you all the best during this important conference. Kia manuia.
Thank you. Thank you, His Excellency Mr. Mark Makaroa, Minister of Justice of Cook Islands. Next on my list is His Excellency Mr. Tazul Islam, Member of Parliament, Honourable Minister of Local Government, Rural Development and Cooperatives, to be followed by Her Excellency Ms. Amanda Milling, Minister for Asia at the Foreign Commonwealth and Development Office of the United Kingdom. His Excellency Mr. Tazul Islam, the floor is yours.
Respected Chair, esteemed colleagues, distinguished delegates, Your Excellencies, ladies and gentlemen, very good morning to you all. It is my immense pleasure and honor to be part of this great occasion, the second Ministerial Conference on Civil Registration and Vital Statistics in Asia and the Pacific. On behalf of the Bangladesh delegation, I would like to express my heartiest thanks and gratitude to ESCAP and partner agencies for organizing such an excellent event. This is the best forum for sharing our experiences in the achievement of the CRVS decade 2015 to 2024. This will provide us with guidance for the best utilization of CRVS for fulfilling the theme of Sustainable Development Goal. No one leave behind. The theme of CRVS decade is Get Everyone in the Picture. We are proud to note that this theme exactly aligns with the principle of our father of the nation, Bangabandhu Sheikh Mujibur Rahman, who strongly urged upon the world communities to establish local justice, equality. However, his beloved daughter and worthiest successor, Honourable Prime Minister Sheikh Hasina, carried forward the vision of Bangabandhu Sheikh Mujibur Rahman. Accordingly, inclusiveness and social empowerment have been the guiding principle of our development agenda as stipulated in our 8 5-year plan, Vision 2031 and Vision 2041. In Bangladesh, the CRVS implementation mission has started way back in 2014. Moreover, we are also working with our development partner like Vital Strategies, UNICEF, WHO, along with the associate ESCAP to ensure the set visionary goal and target of Regional Action Framework, and SDG. Mr. Chair, under the legal framework of our Birth and Death Registration Act, the government of Bangladesh established the Office of the Registrar General, a central civil registration system for formally register and certify all birth and death. Along with that, Bangladesh has high level political commitment and strong coordination mechanism to setting up an inclusive, effective CRVS system. Mr. Chair, since the first ministerial conference on CRVS 2014, we have made considerable progress as follows. The Office of the Registrar General commenced on website Birth and Registration Information System in 2020. We introduced unique ID, and Office of the Registrar General is using the unique ID during the birth registration. Community registrar are providing congratulatory letter for birth and condolence message for the death to encourage the registration. We link birth and death registration activities as indicator of annual performance agreement of district and sub-district level office. Bangladesh initiate the Kaligon's model of engaging community-based frontline health worker in a formal notification process of birth and registration in collaboration with the extended program of immunization. Local government division enforce online death registration to get succession inheritance certificate from concerned local government organization. Local government division has decided to conduct the inequality assessment in civil registration with support of ESCAP. Besides that, within the COVID even extreme situation, birth and death registration was done normally. Moreover, the Bangladesh government also taking several initiatives to formulate an inclusive CRVS system for time constant. I am not mentioning it in detail. Mr. Chair, in spite of the achievement, we still have some challenge. Established interoperability and synchronization of data among the system. Deduplication of birth registration data, which are migrated into the new BDRIS system from old system. Low demand of birth registration within 45 days and death registration, especially for women and child. Limited human resources at Office of Registrar General and lack of skilled personnel for coding of disease at health facilities. Varied legal and administrative framework, producing vital statistics for civil registration data. Mr. Chair, international and regional support and collaboration will play a significant role in establishing our integrated CRVS system. Technical assistance experiences as well as technology transfer are needed to attain the SDG and CRVS decade vision. Additional donor funding and regional cooperation is required in developing the integrated CRVS system in Bangladesh. I finally would like to conclude my speech retaining our strong commitment to fulfill the declaration of the CRVS decade 2015 to 2024 agenda. Get everyone in the picture by 2024. Excellencies, ladies and gentlemen, thank you very much for patient hearing.
Thank you, Honourable Minister Tazul Islam from the Bangladesh. Next on my list is Her Excellency Ms. Amanda Milling, Minister for Asia at the Foreign Commonwealth and Development Office of the United Kingdom, to be followed by His Excellency Dr. Suharto Monoarfa, Minister for National Development Planning, Head of National Development Planning Agency of Indonesia. Your Excellency Ms. Amanda Milling, the floor is yours.
As leaders, we work in partnership to resolve the most pressing challenges of our age, to forge a better world for our people and for future generations. Data are at the heart of this, and quality civil registration and vital statistics are essential foundations. Quality CRVS data save lives by highlighting the impacts of epidemics and climate change, helping us to prepare and take action. Comprehensive CRVS data enable every person to access services and be active in democratic processes. We should build on our successes, continuing to strengthen data for the public good. Let's use CRVS data to champion freedom, promote the values of democracy and equality, and ensure that no individual is left behind.
Thank you, Your Excellency, Ms. Amanda Milling, Minister of Asia at the Foreign Commonwealth and Development Office of the United Kingdom. Next on my list is His Excellency Dr. Suharto Monoarfa, Minister for National Development Planning, Head of National Development Planning Agency of Indonesia, to be followed by His Excellency Dr. Ayatun, Deputy Minister of Health of Myanmar. Your Excellency Dr. Suharto Monoarfa, the floor is yours.
Your Excellency, Executive Secretary of ESCAP, colleague, Minister, esteemed ladies and gentlemen. Good afternoon, and thank you for inviting me to the ESCAP second ministerial meeting of civil registration and vital statistics. Indonesia has been strengthening our civil registration and vital statistics for the past 10 years. As a result, we have registered 96% of Indonesians under a unique ID number, reached an estimated 99% of adults and granted them an electronic national ID card. We successfully conducted the 2020 population census with our civil registry database as a starting point, and we now have much more complete demographic information of our population. This success was made possible by a whole government approach. Our population and civil registration colleagues worked tirelessly and in collaboration with statistic agency, village, district, and provincial governments and other technical sectors where citizens' vital events occur, such as health, education, and social protection. As much as we are proud of our accomplishment, we are humbled by the remaining gaps we still need to address. Our socioeconomic survey estimates that 23% of under 5 children did not yet have a birth certificate. We aim to have all children under 5 years old registered with a birth certificate by the end of 2024. CRVS systems produce a legal identity document required by most basic services in Indonesia. This makes registering everyone is our key priority. Data from the civil registry are also key in driving inclusive development. We have used our CRVS for many development purposes, such as social security programs, financial services, and health services, to name a few. The civil registry is beneficial in the health sector during the current pandemic, especially in identifying the mobility of people, verifying vaccination incidents, and tracing potential COVID-19 suspects. We recognize that applying data and identity-driven pandemic control may exclude the most marginalized from accessing assistance and participating in our mitigation measures. We will continue to overcome this issue by introducing an integrated approach where essential services become the point of identification for people who lack documentation and can facilitate registration. In addition to a user-friendly application to register birth and death incidents, we collaborate with the Ministry of Health to strengthen cause of death registration. We also appoint trained community members as civil register facilitators at the village level, especially in remote and geographically challenging areas. Indonesia has recently adopted a national strategy on CRVS that consists of 5 pillars. First, the count and register everyone, especially the hidden population and those residing abroad. Second, to strengthen the demand side awareness and capacity. Third, to accelerate registration among vulnerable groups and people with special needs. Fourth, enhancing the governance of vital statistics. And last but not least, improving coordination and collaboration among public and private stakeholders. This national strategy guides the work of over a dozen ministries and local governments. With these strategies, we want to achieve a more universal, inclusive, and continuous civil registration system so our people can enjoy access to services and life opportunities. As importantly, our programs are informed by accurate, complete, and timely vital statistics. We acknowledge the complexity in achieving these goals. Differences in services providers' capacities, lack of infrastructure, competing priorities, and limited financial resources, system, policy, and programmatic silo are the few and most striking challenges. I hope to collaborate with all esteemed participants in this event to share experience and knowledge so that we can learn the best practices and improve our policy and strategies on CRVS. Thank you for your kind attention.
Thank you, Minister for National Development Planning of Indonesia. Next on my list is China. Mr. Yu Shenke, Permanent Representative of Republic of China. You have the floor.
谢谢主席先生。主席先生、女士们、先生们，第一届 CRVS 部长会以来，亚太各国努力推进落实 CRVS 的共同愿景，取得了积极进展。对 CRVS 区域指导委员会和 ESCAP 秘书处提供的支持，中方表示赞赏。中国是世界上人口最多的国家，经过多年的不懈努力，中国建立了较为健全的 CRVS 体系。该体系为中国政府制定政策、推进基本公共服务提供准确的数据依据，也为更好落实2030年可持续发展议程提供了坚实的支持。2020年，中国克服新冠肺炎疫情的影响， 如期开展了第7次全国人口普查。中国落实共同愿景取得的进展，有以下几点经验分享：一、中国政府高度重视，持续投入。中国共产党和中国政府致力于不断改善人民生活，加大了对 CRVS 的民生领域的投入。中央政府统筹指挥，各地区部门通力配合，基层人员严谨负责，民众积极配合，系统性有序推进 CRVS 的工作。第二，相关部门分工明确，协调配合。中国 CRVS 数据目前分布在不同的部门，但是各部门分工明确，统计局、公安部、民政部、卫健委、教育部各司其职。同时，中国不断完善相关国家协调机制，以更好统筹人口登记与发展数据。三、利用科学利用信息技术，安全高效。中国已经建成人口数据综合应用集成平台和国家人口基础信息库，实现了跨部门人口基础信息的互联互通、动态更新和综合集成，同时严格管理统计数据，保障个人隐私和信息安全。第四，积极开展国际合作，共同进步。过去数年，中国与“一带一路”国家及联合国人口司、人口基金开展了系列合作，通过南南合作，为促进发展中国家的 CRVS 能力建设取得积极进展。女士们、先生们 ，CRVS 10年已过半，亚太地区实现共同愿景还面临许多挑战。新冠肺炎疫情仍在蔓延。各国需要加强团结，增进合作。首先，要用好 ESCAP 的平台，加强国际合作。各方可根据各国的国情、发展需要和优先事项，在 ESCAP 平台开展经验交流、能力建设和项目合作等，促进各国 CRVS 体系建设。第二，统筹相关部门，加强顶层设计。CRVS 工作涉及多个部门，应从国家层面加强顶层设计，确保各部门协调配合，同时促进全社会的积极参与，并保障充足的资金支持。第三，提升 CRVS 的韧性，加强专业素质，促进能力建设，提升民事登记员的专业素养，帮助统计人员提高数据处理、整合能力，更好地应对各种危机。女士们、先生们，中方愿同亚太各国一道，合力推进 CRVS 体系建设，努力实现共同愿景，落实本次部长会宣言的内容，更好地推进疫后复苏和2030年可持续发展议程的落实，推动构建人类命运共同体，不让一个人掉队。谢谢主席先生。
Thank you, Mr. Yushenke, representative of China, for your statement. We're still having a technical issue with Myanmar, and if you're listening, please click request to speak again when you're ready, and meanwhile, we will go to the next speaker. Next speaker on my list is Mr. Leo Malagar, Assistant Secretary and Deputy National Statistician, Civil Registration and Central Support Office, Philippine Statistics Authority, to be followed by His Excellency Nguyen Han Ngoc, Vice Minister of Justice of Vietnam. Mr. Leo Malagar, the floor is yours.
Thank you, distinguished Chair, Excellencies, Madam Executive Secretary, Chair and Vice Chairs, and distinguished delegates, good morning. As a concrete manifestation of the Philippine government's support for the outcome of the first ministerial conference on CRVS in Asia and the Pacific, Proclamation number 1106 was signed on 20 August 2015 declaring the years 2015 to 2024 as the CRVS decade and adopting the localized theme, Get Every Pinoy and Pinay in the Picture. The proclamation strengthens the establishment of the national coordinating mechanism for the implementation and monitoring of an effective and efficient CRVS in the country. Aligned to achieving the initiative, the Interagency Committee on Civil Registration and Vital Statistics was created, composing 9 national government agencies. The committee serves as a venue for the discussion and resolution of CRVS issues, the review of current techniques, methodologies, strategies, and the recommendation of policies and workable procedures towards the improvement of CRVS in the country. The modern use of technology has paved the way towards delivering more efficient, customer-centric services in this rapidly changing world. The PSA continues to digitize its civil registration operation through public-private partnership. The CRS Information Technology Project Phase 2 involves the computerization of the civil registration operations. Using imaging technology, it is designed to collect, access, store, maintain, and manage civil registration documents, including the specimen of signatures of local civil registrars. The PSA collaborated with Vital Strategies and University of Melbourne to improve the timeliness, completeness, and accuracy of vital statistics generated from 2015 to 2019. The project also introduced interventions and trainings under the Data for Health initiative, supporting the national CRVS initiatives and priorities. The project includes the systematic review of CRVS systems through the CRVS Enterprise, training in Anaconda, the continuous quality improvement and capacity building to estimate the completeness of birth, death registration, and the introduction and support for automated coding of causes of death through IRIS. To provide timely and accurate data for policy and decision-making, the birth, death, and marriage statistics, which were then released quarterly, are now released monthly starting October 2021. The schedule of data dissemination of the vital statistics was modified from 2 years to now 11 months after the reference year for marriage statistics, 12 months after the reference year for birth statistics, and 13 months after the reference year for death statistics. Towards increasing birth registration, various initiatives and partnerships with government and non-government organizations were fostered to register the births and other civil registry documents of indigenous peoples, Muslim Filipinos, and other marginalized sectors of society. Some of our significant projects include, number 1, partnership with the Department of Foreign Affairs in the registration of more than 10,000 undocumented Filipino workers and their families, a birth registration project in province of Baclan to register 10,000 unregistered births of indigenous peoples and the poorest sector, the birth registration of 3,000 Moro National Liberation Front decommissioned combatants and issuance of their Philippine national ID, the birth registration of 15,000 Mangyans in Oriental Mindoro in partnership with a non-governmental non-profit organization, the initiative to end statelessness through registration of persons of Indonesian descent and Sama Bajaus in Mindanao. Meanwhile, the target level of 90% completeness of death registration for the period 2015 to 2020 has been achieved based on our CRVS mid-decade assessment. However, more work needs to be done to improve the registration of deaths to cover the remaining 10% that include, among others, death registration of Muslims, indigenous peoples, and other marginalized sectors. Since 2019, the Philippines, just like most countries in Asia-Pacific region, continues to be affected by the COVID-19 pandemic. This served as motivation for the PSA to adopt the theme, Strengthening Civil Registration and Vital Statistics, Digital Information, the Ways to Manage the New Normal in all our activities for this year. Given the new normal, our efforts in improving the delivery of our civil registration and services and vital statistics must be geared towards making our processes more convenient and safer for our clients, partners, and stakeholders. Our journey to improve the CRVS in the Philippines is never ending. We had a good start and have stayed on course. However, the momentum gained must be sustained despite the challenges and the threats of this pandemic. We need to ensure that no Filipino child is born stateless and that every vital event in a child's lifetime is recorded. It is also our fervent wish that the highs and the hype about CRVS will continue even beyond the year 2024. Thank you very much, Mr. Chair.
Thank you, Mr. Leo Malagar, Assistant Secretary of Statistics Authority of Philippines. Next on my list is His Excellency Nguyen Khan Ngoc, Vice Minister of Justice of Vietnam, to be followed by Myanmar. Excellency, the floor is yours.
Dear ministers, delegates, ladies and gentlemen, it is my pleasure to attend this important second CRVS Ministerial Conference in Asia and the Pacific. By organizing this conference in the midst of COVID-19 pandemic, we are sending a strong message that our Asia and the Pacific are committed to CRVS improvements and have been working toward our shared visions, goals, and actions, which were endorsed by the ministers 7 years ago. Clearly, our commitments have advanced the UN 2030 Agenda for Sustainable Development and ensuring that no one is left behind. Ladies and gentlemen, since the first ministerial conference, members in our regions have made enormous efforts to overcome difficulties and challenges in implementing the ministerial declarations and regional action framework on CRVS. The summary of getting everyone in the picture, a snapshot of progress midway through the Asia and Pacific civil registration and vital statistics decade produced by the ESCAP allow us to see the reality of progress and challenges in our long and difficult journey. For Vietnam, the ministerial declarations and regional action framework on CRVS have been implemented through a comprehensive national action plan on CRVS approved by the Prime Minister, who also set up a national interministerial committee headed by the Minister of Justice to oversee the implementation of the action plan. All these efforts have been integrated with the implementation of the new 2014 law on civil registrations and the National Action Plan for the implementation of the UN 2030 Agenda for Sustainable Development. As a result, there have been many progress of CRVS in recent years, making CRVS more important in the state administrations and the exercise and enjoyment of rights by Vietnamese citizens and foreigners in Vietnam. Ladies and gentlemen, we are pleased to see the progress of our work that we have carried out together since the first ministerial conference. But we are not at the finish line yet. We have identified the gaps, issues, or areas that need more work to be done to achieve the agreed goals. When there are only 3 years left and new issues and challenges, including the COVID-19 pandemic, climate change, are affecting our normal life and work, that certainly requires our extra energy, resources, and cooperation. In closing, Vietnam is looking forward to working with other delegations for the success of this second CRVS Ministerial Conference. Thank you very much.
Thank you, Excellency Nguyen Khan Ngoc, Vice Minister of Justice of Vietnam, for your statement. Next on our list is Excellency Dr. Aye Tun, Deputy Minister of Ministry of Health of Myanmar, to be followed by Dr. Pandup Tsering, Secretary Ministry of Health of Bhutan. Excellency Dr. Aye Tun, the floor is yours.
Your Excellency, distinguished delegates, ladies and gentlemen, on behalf of the Myanmar delegation, I wish to congratulate the Commission for organizing this second ministerial conference on civil registration and vital statistics to celebrate the achievement of the first half of the region CRVS decade. The registration of birth and death in Myanmar started at the beginnings of the 20th century in 1907. The system was gradually improved throughout the years in registering all births and deaths across the country. According to the Demographic and Health Survey in 2015 and 2016. Bus registration coverage has reached 81.3%. However, there's a difference between urban and rural, with 93.9% and 77.7% respectively. The bus registration coverage was increased through the intervention of the bus registration campaign, refresher courses for implementers, and public awareness activities on the importance of bus registration. Nevertheless, there were some limitations for Asian geographic coverage in reaching all people. And the government has encouraged all stakeholders to cooperate in timely registering of all births and deaths that occur within country. In accordance with country commitment to the regional action framework, we have made follow-ups in signing the Civil Registrar General and initiate the development of a comprehensive CRVS law since the beginning of the year 2020. During 2015-2020, we have worked on the vital registration e-platform, and now a digital archiving system has been set up in the country that creates permanent records of vital statistics. All registration data are made accessible for planning, implementation, and decision-making. However, we are still working on digital data collection to obtain real-time data and trying to improve its data uploading and sharing system. In Myanmar, the manual on birth and death registration was endorsed in 2017, which guarantees universal birth registration. That is, all under 10 children born in Myanmar is registered and obtain their birth certificates. As stated above, we have established the vital registration e-platform and scaled it up across the country during the same years. With the support of the UNICEF in 2019, Myanmar piloted the mobile birth and death registration project in one pilot state. More than 550 midwives are using mobile tablets to collect both birth and death data, upload those data for registration and certification. The evidence generated from this project is planned to be used for a national scale-up in 2021. Excellency, distinguished delegates, despite these promising initiatives, Myanmar still continues to struggle with the challenges which other LCD also face in improving the CRVS system. In this respect, the government of Myanmar has closely collaborated with UNICEF as a long-standing partner and will continue its collaboration with all development partners and to seek both financial and technical support for strengthening its CRVS system and making it universal and responsive in Myanmar by 2024. Thank you very much for your attention.
Thank you, Excellency Dr. Ayetung, Deputy Minister of Health of Myanmar. Next on my list is Dr. Pandop Tsering, Secretary of the Ministry of Health of Bhutan, to be followed by Ms. Guljamile Anyanazava, Deputy Chairman, State Committee for Statistics of Turkmenistan. Dr. Pandop Tsering, the floor is yours.
Thank you, Chair. Your Excellencies, distinguished delegates, ladies and gentlemen. On behalf of the Royal Government of Bhutan, let me begin by thanking ESCAP for the opportunity. I am pleased to share some of Bhutan's achievements and experiences in improving the CRVS system. Bhutan participated in the first Ministerial Conference on CRVS in 2014, along with the 21 other countries of Asia and the Pacific, and as party to the Ministerial Declaration on the CRVS decade. The Ministry of Health, Royal Government of Bhutan, represented the government in the first meeting of the Regional Steering Group meeting to discuss a way forward and put mechanism in place for rolling out the strategies of the Regional Action Framework. Mr. Chairman, distinguished delegates, ladies and gentlemen, ever since the conference, the government made noteworthy development in the way the CRVS system in Bhutan was coordinated and operated. The Ministry of Health, the Department of Civil Registration and Census, and the National Statistical Bureau jointly conducted both the rapid and comprehensive assessment of the Bhutanese CRVS system in 2016, through which several changes were identified and recommendations proposed. Among others, the lack of a legal and institutional framework governing CRVS system, incompleteness of the registration of vital events, non-compliance of ICD coding practices, passivity of the vital statistic system, etc., were recognized as critical gaps requiring prompt actions. Closely following the recommendation of the assessment, the coordination and communication among the core government agencies of CRVS system enhanced substantially. The central agencies and local government administration coordinated to improve the procedures for notification and registration of birth and deaths. Bhutan also published the first ever vital statistics report in 2020 using the civil registration data to inform policymakers for evidence-based policy planning and programming. In 2019, the mission from the UN ESCAP identified several bottlenecks in the current CRVS system in Bhutan and strongly recommended another round of assessment using the principles and approaches of the CRVS improvement framework. Duly recognizing the recommendation, Bhutan has carried out another assessment and currently in the process of finalizing the first ever national multi-sectoral CRVS strategy in 2021 to further consolidate and intensify efforts for the remaining years of CRVS decade. With the strategy in place, we aim at strengthening CRVS governance and functioning, improving birth and death registration, including correct assignment of causes of death using internationally recognized standards, improving the monitoring and evaluation framework for CRVS, and producing timely and quality vital statistics reports. Mr. Chair, ladies and gentlemen, Bhutan also leverages on ICT and digital technologies to strengthen the CRVS system and its application. The implementation of web-based civil registration system has remarkably speeded up the verification and validation processes at registration services delivery points in all districts and enhanced the efficiency of civil registration services. Other ongoing digital technology-based initiatives which have huge potential to enhance CRVS system include the National Digital Identity Project and the Electronic Patient Information System undertaken as the digital flagship program of the Royal Government. Such initiatives are not only expected to generate quality information and vital statistics of Bhutanese citizens, but of the entire people residing in the country. The Ministry of Health also implements mother and child tracking system using the DHIS2 platform, which tracks mother and child from pregnancy until the child attains the age of 5, which will be integrated with the civil registration system. Bhutan vaccine system was integrated with the civil registration system and was effectively used during the nationwide first dose COVID vaccine campaign from 20th March to. This was also used for the subsequent second dose for other groups of population also. As a result, the coverage for vaccination among the eligible population has been achieved. Bhutan's total population were vaccinated in a very short time. Bhutan has immensely benefited for being a signatory to the Ministerial Declaration on CRVS. The technical and financial support received under the regional commitment has helped us to understand the gaps and weaknesses in our system and the means to address them.
Thank you, Dr.
Communication among the core agencies of the CRVS system enhanced considerably. As compared to the situation a decade ago, today policymakers, planners, and administration of the government agencies are much more aware of the importance of mobilizing and investing resources and efforts in the CRVS system at the national and subnational level. Despite impressive progress, Bhutan's CRVS system is far from being perfect and needs effort to address several shortcomings. On his part, Bhutan will continue to enhance its support to the regional CRVS initiative. Thank you for your attention. Thank you very much.
Thank you, Dr. Pandop Tsering, Secretary of the Ministry of Health, Bhutan. Now, next on my list is Ms. Guljamilia Ananyazova, Deputy Chairman, State Committee for Statistics of Turkmenistan, to be followed by Ms. Nancy Izo Jackson, Senior Bureau Official, Bureau of Population, Refugees, and Migration of U.S. Department of State of the United States of America. Ms. Guljamilia Ananyazova, you have the floor.
Уважаемый господин председатель, уважаемые дамы и господа, позвольте выразить признательность за возможность принять участие в работе второй конференции министров по регистрации актов гражданского состояния и статистики естественного движения населения в Азиатско-Тихоокеанском регионе и пожелать всем участникам конференции успешной работы. Уважаемые дамы и господа, разрешите поделиться информацией о развитии статистики естественного движения населения в Туркменистане. Статистика естественного движения населения Туркменистана основана на системе регистрации актов гражданского состояния. В соответствии с законом Туркменистана о регистрации актов гражданского состояния, второй экземпляр актовой записи о рождении и смерти, формируемых в органах ЗАГСа, предоставляется в региональные органы статистики. Полученные данные позволяют сформировать информацию о естественном движении населения Туркменистана. Запись актов гражданского состояния является конфиденциальной, так как содержат сведения, позволяющие идентифицировать людей. Меры защиты от разглашения персональной информации в процессе разработки агрегированных статистических данных определены законом о статистике, статья 24. Для статистической разработки данных о смертности населения применяется международный классификатор болезней Всемирной организации здравоохранения 10-го пересмотра. И краткая номенклатура причин смерти основана на международной статистической классификации болезней, травм и причин смерти 10-го пересмотра, утвержденной Министерством здравоохранения и медицинской промышленности Туркменистана совместно с Государственным комитетом Туркменистана по статистике. В Туркменистане в рамках глобальной программы МИД регулярно проводится кластерное обследование по многим показателям, разработанное в соответствии с методологическим приложением МИД с целью предоставления сопоставимых статистических данных на международном уровне о положении детей и женщин в стране. В вопросе естественного движения населения и регистрации актов рождения и смерти также включены вопросы МИД. В 2019 году в Туркменистане был проведен 6-й раунд МИД. Опросы МИД позволили Туркменистану сформировать данные для использования в национальных программах и планах социально-экономического развития, а также для мониторинга прогресса в достижении целей устойчивого развития. МИД-6 включает данные по более 30 индикаторам СУР. Данные МИД-6 опубликованы на сайте ЮНИСЕФ. Для статистики естественного движения населения огромное значение имеет информация, полученная по итогам сплошной переписи населения и жилищного фонда. В настоящее время проводится подготовительная работа для проведения сплошной переписи населения и жилищного фонда Туркменистана в 2022 году. Огромную техническую и методологическую поддержку по проведению данного мероприятия статистическому ведомству страны оказывает международная организация, в том числе Фонд народонаселения ООН. В контексте всеобщей цифровизации, в том числе и цифровизации статистической деятельности, необходимо отметить, что вся первичная статистическая информация обрабатывается программными обеспечениями. Также при сборе данных в МИД-6 в 2019 году, как и в МИД-5 в 2015-2016 годах, был использован метод КАПИ, то есть электронный ввод данных при личном опросе с использованием планшетов. Этот же метод сбора данных предусматривается использовать и для проведения сплошной переписи населения и жилищного фонда Туркменистана в 2022 году. В заключение хочу поблагодарить Министерство иностранных дел Туркменистана, а также секретариат экономической и социальной комиссии ООН по Азиатско-Тихоокеанскому региону за организацию данной конференции. Всем участникам конференции желаю здоровья и успехов, а странам Азиатско-Тихоокеанского региона процветания. Благодарю за внимание.
Thank you, Deputy Chairman of Turkmenistan, for your statement. Next on my list is Ms. Nancy Izo Jackson, Senior Bureau Official of the Population, Refugees, and Migration, U.S. Department of State. The floor is yours.
Your Excellencies, distinguished delegates, ladies and gentlemen, My name is Nancy Izzo Jackson. I head the U.S. State Department's Bureau of Population, Refugees, and Migration, which leads U.S. efforts to provide protection, ease suffering, and resolve the plight of persecuted and forcibly displaced people around the world. I am honored to join you today. The United States appreciates the opportunity to work with ESCAP on multilateral solutions to common challenges. As Secretary Blinken has emphasized, and I quote, "Human rights and dignity must stay at the core of the international order." That is, in essence, what we are discussing, the responsibility of governments to treat individuals with dignity and respect. We have long championed efforts to ensure that all individuals benefit from civil registration and vital statistics systems. Building such systems and tearing down barriers to civil registration are essential to protecting the most vulnerable: women, children, older persons, persons with disabilities, minority groups, stateless persons, and persons on the move, including refugees, asylum seekers, internally displaced persons, and vulnerable migrants, often find themselves caught in a vicious cycle of exclusion from civil registration. We cannot ignore their plight. Eradicating statelessness, ensuring children have access to education, empowering women, these are all part of the shared vision behind which I hope we can all continue to stand. The progress made during the first half of the Asian and Pacific Civil Registration and Vital Statistics decade is commendable. That progress took a lot of hard work. It will take even more work over the second half of the decade. That is why the United States is committed to supporting your efforts as we make strides towards achieving goals in the Regional Action Framework. Our humanitarian assistance, for example, supports your commitments to reduce statelessness. As the largest single donor to UNHCR, we strongly support the #IBelong campaign. In the Philippines, for example, U.S. support enabled UNHCR's work with UNICEF and local groups to launch a birth registration drive among nomadic seafarers at risk of statelessness. We praise Tajikistan, Kazakhstan, Turkmenistan, and Uzbekistan on efforts to ensure universal birth registration, and commend the Kyrgyz Republic on the eradication of all known statelessness cases. We applaud Thailand's leadership of the IBelong campaign's group of friends and appreciates its work to promote efforts globally and at home to protect stateless persons. We urge Myanmar to ensure civil registration and access to citizenship for Rohingya. Beyond humanitarian aid, we provide technical support through resource development, capacity building, and collaboration on sustainable systems improvements. We look forward to continuing this work together to address common challenges and to find long-lasting solutions that protect the human rights and dignity of all people. Thank you.
Thank you, Ms. Nancy Jackson, for your statement. Would any other delegations from the member or permanent observers of the Commission like to raise any other matters on this agenda item at this time? I see none. So we have exhausted our time allowed for this agenda item. Thank you for your interventions. Unfortunately, we won't be able to open the floor to observers organizations, intergovernmental organizations, and other entities. The written statements will be nevertheless be posted on the website of the conference and be reflected in the summary of the proceedings. Thank you all for your statements. Indeed, all are key perspectives that for each of us in this room to consider within in our own country context. This brings us to the conclusion of discussions under agenda item 10. I would like to hand the floor to the Secretariat to make some key announcements before we have a break.
Thank you, Mr. Chair. First, we would like to ask all distinguished delegates and participants to tune in through Kudo using the same link as this morning at 2 o'clock Bangkok time to start agenda item 11, the importance of civil registration and vital statistics and legal identity for all to accelerate progress on the 2030 agenda. Further, during the 2-hour break, you are invited to join the Ministerial Roundtable on building resilient civil registration and vital statistics systems, incorporating lessons from COVID-19 in the second half of the Asia-Pacific CRVS decade. The Ministerial Roundtable will take place from 12:30 to 1:30 p.m. Bangkok time on YouTube at the same page as the present segment. The details on the event are being shown on the screen. Thank you.
Excellency Samdech Krolahom Sarkheng, Deputy Prime Minister and Minister of Interior of Cambodia, Excellency Mr. Thongchan Maniksai, Minister of Home Affairs of Lao PDR, Excellency Mr. Leota Lamositelelaki Sio, Minister of Women, Community and Development of Samoa, Excellency Ms. Saifa Mohammed, Deputy Minister of Health of Maldives, Excellency Mr. Pankar Anwarul Islam, Cabinet Secretary of Bangladesh, Excellencies, distinguished delegates, ladies and gentlemen, I'm delighted to welcome you all to this Ministerial Roundtable on Building Resilient CRVS System, incorporating lessons from COVID-19 in the second half of the Asia-Pacific CRVS decade. The COVID-19 pandemic has affected the ability of governments to maintain services and routine functions, including the operation of National Civil Registration and Vital Statistics, or CRVS systems. The universal, compulsory, continuous, permanent, and confidential recording of the occurrence of all vital events is undermined by the various restrictions imposed by governments, such as quarantines, lockdowns, social and physical distancing measures, workplace closure, transit shutdowns, and many more. The resulting changes in civil registration systems are detrimental to the quantity and quality of civil registrations. Many CRVS systems have considered marriages and divorces to be less important vital events, and a number of countries have suspended recording them. While innovative approaches are mitigating the effect of COVID-19 on the performance of civil registration systems and are supporting the generation of data for health surveillance during a health crisis, this often disproportionately excludes developing countries with poorer connectivity and infrastructure. This Ministerial Roundtable will provide an opportunity to reflect on the challenges posed by the pandemic and potential solutions. Ministers will be able to share their experiences of maintaining services during this difficult period and inspire and guide efforts to enhance the functioning of CRVS systems during emergencies in the second half of the Asia-Pacific CRVS decade. I'm delighted that we have such esteemed participation by ministers in this event, highlighting the importance accorded to CRVS. And I would like to thank our moderator, Ms. Harpinder Kolakot, Chief Executive Officer of Development Initiatives, for kindly agreeing to moderate this roundtable. Excellencies, distinguished delegates, I'm confident this event will share valuable approaches and good practices on improving CRVS systems to be more resilient for future crises and pandemics, and encourage innovative ways to achieve this. I look forward to the rich discussion today. Thank you very much.
Thank you very much, Madam Speaker and Executive Secretary. Welcome to the Ministerial Roundtable on Building Resilient CRVS Systems, incorporating the lessons from COVID-19 in the second half of the Asia-Pacific CRVS decade. In this session, we will hear from esteemed ministers from whom we have invited 3 rounds of comments, followed by, if time permits, a brief discussion and then closing statements. We have an hour for our panel today, and we've got an incredibly highly esteemed panel, so I'm hoping we will have time to go through everything that we are intending to cover. My name is Harpinder Kolakot. I am the Chief Executive Officer of Development Initiatives, and I have the pleasure of chairing this panel with us today. Development Initiatives is an organisation that puts data-driven evidence in the hands of policymakers to support actions around ending poverty, reducing inequality and building resilience. We work with partners around the globe to build strong, resilient national and subnational data systems which will improve data on people and ensure that policymakers can make the right decisions at the right time. So let me start off today by briefly introducing our panel of ministers, and then I will invite our guests to present their remarks. I am told this session cannot overrun, so I will be asking our panel to respectfully stay within the time that they have been allocated. First of all, let me introduce our esteemed panel this morning. Firstly, we have Somdet Karalhom Sanker, of Deputy Prime Minister and Minister of Interior of Cambodia. Secondly, we have His Excellency Mr. Kandahar Anwar Islam, Cabinet Minister Secretary of Bangladesh. We also have with us His Excellency Mr. Thongchen Manieks, Minister of Home Affairs, Lao PDR. The Honourable Leotet Lemesetel Laki Sao, Minister of Samoa, Bureau of Statistics and Ministry of Women from Samoa. And the Honourable Ms. Safia Mohammed, Deputy Minister of Health from the Maldives. Welcome to you all this afternoon. But before we begin, I would like to take this opportunity to pass on my deepest condolences from all of us here today to the Minister from Samoa of the recent passing of Miss Melafone, who was the National Statistician and Civil Registrar General of Samoa. Your Excellency, please accept our deepest sympathies and convey them to Miss Melafone's family, friends and colleagues of the tragic loss that we have seen this weekend. Now, without further ado, let me move on to our first question. The first thing that I would like to ask all of our honourable guests today is to comment on how their countries have responded to the challenges posed by the pandemic to civil registration systems, and how they have ensured that those who are the most marginalised and vulnerable in their populations have continued to access vital services in the face of disruption. I'm going to firstly turn to Somdet Karalhom from Cambodia to get us started. Thank you.
Thank you. Excellency, Ms. Armida Salsiah Alisjahbana, Deputy Undersecretary General of the United Nations and the Executive Secretary of ESCAP. Excellencies, ladies and gentlemen, the COVID-19 pandemic has prolonged with great uncertainty due to the new surge of coronavirus mutation, which is more deadly and which continues to disturb socio-economic activities. And it has also the impact on the ability of Cambodia's government to maintain its services and routine function of the CRVS systems. In this complicated and strenuous context, the royal government of Cambodia has strived to build social resilience by focusing on health system development, promoting quality and greater scope of public health and social protection services, as well as
human resource development. The royal government of Cambodia has rolled out vaccination as a key strategic measure to prevent the community transmission and to strengthen treatment capacity in combination with other social and economic intervention strategies aiming at stabilizing businesses and livelihoods of its people. The CVRs, both mature and immature, has continued to function based on practical situation of the regions. The aforementioned strategies and measures have significantly contributed to creating favorable environments for the sustainable registration of vital events for the most marginalized and vulnerable populations in particular. This is how Cambodia responds to the challenges posed by the COVID-19 pandemic in contribution to the expeditious recovery of the CRVS systems and their continued functioning. Thank you.
Thank you so much for your comments, and thank you so much for starting off this panel as well. I'm going to now turn to His Honourable Cabinet Secretary Islam from Bangladesh.
Okay. The moderator, Honourable Ministers, Excellencies, ladies and gentlemen, Assalamu alaikum. It's my great pleasure to be virtually present in this meeting. On behalf of Bangladesh, I would like to thank ESCAP and other organizations for giving us this opportunity. Excellencies, ladies and gentlemen, as one of the most densely populated countries in the world, we require very efficient civil registration system in order to get everyone in picture. Under the leadership of Her Excellency Prime Minister Sheikh Hasina, Bangladesh has a very high-level political commitment for strengthening the CRVS. The local government institutions are actively engaged in birth and death registration all over the country, and marriage registration department has been assigned to go for the registration of the marriage since 1961 under legal provisions. One of the important efforts of our whole nation is the social safety net program, which amounts to be 18% of the national budget and 3.11 of the GDP. To ensure the maximization of resource utilization and cover maximum beneficiaries, CRVS system is an imperative step. Further to note is that our all stipends and benefits given to millions of incumbents are based on CRVS. During the pandemic, we actually felt the need of the CRVS. As our Prime Minister Sheikh Hasina delivered 31-point multi-dimensional program, guideline and incentives in order to combat COVID-19 challenges. Almost in all those initiatives and programs, CRVS played a vital role in the form of use of national ID, introducing national unique ID, online birth and death registration and the certificate, and rapid mortality and surveillance and cause of death finding. By using these CRVS tools, we are successful in drawing effective programs and benefiting millions of people. One of the important was the developing the COVID map of the whole country, which clearly revealed the area of effect, severity, and the future projection of the COVID situation. It led us, health workers and social workers, to come forward with prior programs, for which we think was one of the important reasons that our devastation was comparatively less. Number two was the massive financial package which were declared by the Prime Minister. Millions of people were assisted and relief were distributed by using national ID, birth certificate. they had their transaction account by using those NIDs and birth certificates. So nobody could be out of the account in that program. And in another was that the massive vaccination programs which were carried out and is still being carried out are based on absolutely on NID and birth certificate. So we can easily count each and everybody who is are being vaccinated. CRVS also played an important instrument in actually determining the severity of the COVID effect when we found that the unusual rise of the death count were taking place in some place, and we actually compared to the original statistics. So our doctors and clinical persons intervened there and actually took proper action. So CRVS system, but still we need some strengthening of this, no question about it. Since the first ministerial conference, every member state certainly has some success, which we can call to be the first CRVS decade. And now it is the second one, and we must address all challenges by working together with the government and development partners. International and regional support and collaboration will play a significant role to establish a more resilient CRVS system. So in this regard, we have got some very precise recommendations, such as interlink the civil registration and identity management system by ensuring the legal framework, assess the inequalities of CRVS and identify the marginalized and vulnerable groups in order to include them. Then it is necessary to establish a feedback procedure to overcome the barriers of the system and set up a hotline calling system to address the people's need. And then it is required to ensure that business processes are simplified and made workable so that they can be effective both in normal and crisis situation. And then develop community awareness of the registration process and benefit of the registration to create demand on the citizen side. We have taken this to be a very important tool, in fact. Promote more electronic and other media to highlight the necessity of birth and death registration and other CRVS tools in order to create awareness among all. And another one is the government must have a whole of government coordination mechanism. I mean, integrated approach among all the departments of the government. Last but not the least, of course, mutual exchange of the best practices, learning and experiences of the member states will certainly help all to redesign the resilient CRVS system. So with this, I would like to conclude. Thank you all.
Thank you very much. That was very comprehensive and very interesting. I'm going to now turn to the Honourable Minister from Laos to give us his responses to this question.
Thank you very much. Thank you very much, our honourable moderators and excellencies, esteemed panelists, ladies and gentlemen. The government of Laos PDR, or in the context of Laos PDR at the moment, as you are aware that we are part of the global communities that are being adversely affected by the COVID-19. We first suffered heavily around mid-May 2021. We still have a high numbers of the COVID-19 transmission at the community level. Right now, we have about 700,000 of people infected with COVID-19. At the moment, about 10,600 being treated. 116 have already been the casualties of the COVID-19, and still hundreds more that being quarantined. Ladies and gentlemen, the COVID-19 pandemic, needless to say, that has posed significant impacts to the way of lives of the people, has disrupted the service deliveries of the government, including the civil legislation. The civil legislation during this time, I think like any other economies, that we would expect global rate of legislation. Yes, we have already put in a number of efforts in order to prevent the COVID-19 pandemic, in particular to increase the coverage of the vaccination. Hopefully that by the end of 2021, we'll be able to hit the 50% target of the population for the vaccination coverage. We're also working hard in order to reintroduce the new normal. Yet, but we cannot compromise the health of our people. A lot of people are still hesitant to register their vital events given the ongoing pandemic. Even though that our registrar offices all around the countries are still serving the public on a regular basis, but we see the drop of the registration. As for the debt registration, the cost of debt registration and the certificates of the debt registration during this time of crisis is even very important. And this is the very important job of our District Office of Home Affairs to register all the debt events so that we can identify whether such debts related to the COVID-19 or not, and in order to make sure that we can reintroduce the way of life as it used to be. Thank you very much.
Thank you so much. Thank you so much, Minister. Do we have the Honourable Minister Sao of Samoa with us, and could I invite his comments?
Thank you. First, I wish to express our sincere gratitude for the messages of sympathy and the kind sentiments shared on the untimely passing of our dear colleague and government statistician, Arimua Malaifono Tawa Fasalaina. She has been a stalwart leader for our Bureau and a hard-working public servant that has for more than 30 years contributed to providing relevant quality statistics to support informed decisions to better the lives of the people of Samoa and the region. In terms of the topic discussed, Samoa still remains a COVID-free nation. Hence, it has faced minimal impact to its civil registration system. As well, everyone has equal access to civil registration systems. It was during the early days of the pandemic that some interventions such as lockdowns were imposed, that there was limited access to the civil registration systems. However, a first-time nationwide mass registration campaign was conducted to capture all the unregistered events. The use of technology to connect virtually around the world during these challenging times provides an opportunity for the civil registration system to grow and adapt to ensure such services are available at all times. It is important to ensure civil registration authorities maintain operational continuity during COVID-19 and allow for continued production of comprehensive vital statistics. In summary, some of the issues that we are looking at to strengthen this is our commitment to enhance infrastructure, IT within our country, so that to improve access to connectivity on that basis. Thank you.
Thank you so much. It's incredible that Samoa remains COVID-free, and I hope that may last as long as possible. And finally, I'm going to move to the Honourable Deputy Minister from the Maldives.
Thank you for the opportunity, Ms. Collicott. I'm Secretary General of the United Nations and Executive Secretary of ESCAP, fellow ministers of the Roundtable. Assalamu alaikum. Maldives was first hit with COVID-19 in April 2020. During this time, we faced numerous challenges and disruptions in the delivery of vital services to the public. This includes the disruption of issuance of national identity cards, which is the unique identifier for accessing a lot of our services across the country, such as the use of healthcare, national health insurance scheme, travel, and banking. As an immediate action to curtail any difficulties faced by the public, senior policymakers of the Maldivian government made the decision to impose a moratorium on issuing identity cards. This allowed the temporary use of any outdated national ID cards and other forms of identification, such as driving licenses and passports that can be linked back to the national unique identifier for accessing any services given to the public. Apart from this, several digital applications were developed to provide services related to COVID-19, including sampling, quarantining, isolation, vaccinations, and contact tracing. All these applications utilized the national ID number to track everyone and enabled communication between systems and reduced data duplication, leading to a streamlined provision of services. Additionally, His Excellency President Ibrahim Mohamed Solih made an executive decision and commitment to providing equitable care and vaccinations to all residents of the Maldives, including the expatriate population. It is our mandate at Ministry of Health to ensure that we leave no one behind when providing vital services. One of such marginalized groups that we have in our community are the undocumented migrants. The COVID-19 response highlighted the importance of establishing a mechanism to uniquely identify such undocumented migrants so that we can eliminate the barriers that they face on a regular basis when accessing services. We addressed this by collaborating with stakeholders to reach out to such migrants and developed a registry which assigned a unique identifier to access all services. A lot of our non-government institutions helped us on this endeavor, and we are entirely grateful to all the support that we received from everyone, from all relevant stakeholders in the Maldives. Thank you.
Thank you so very much. That is very interesting to hear about the unique ID cards and the challenges you face there as well. I'm going to move on to our next question, which is actually building on what we've already heard of some of the successes, but it's about looking at the future, really. How can governments and development partners comprehensively make the CRVS systems in the countries more robust for future crises and shocks? So what have we learned from the measures that have been put in place as a result of the pandemic, and how can these systems be made more robust for the future? And I'm going to come back to our first speaker now, Somdet Karalhom of Cambodia. Over to you.
Thank you very much once again. Excellency Armida, Salsiah, Alisjahbana, Undersecretary General of the United Nations and Executive Secretary of UN ESCAP. Good afternoon, Excellency, ladies and gentlemen. For guidance on the restructuring and strengthening of more mature CRVS system and on quick recovery from the crisis and emergency situation, as well as on adaptation to new situations, Cambodia is currently implementing a number of initiatives as laid out in the 10-year National Strategic Plan on Identification from 2017 to 2026 in an objective to provide assistance and also support on civil registration and vital statistics system. Cambodia is investing in computerizing civil registration by applying web and mobile technologies. Mobile technology will facilitate the civil registration of vital events in areas that are remote and otherwise isolated, and will support regular mobile registration days in all communes and villages. In the short-term period, Cambodia is piloting and rolling out commune-based one-window services where people can come to register vital events and apply for ID cards. In the long run, Cambodia aims to have civil registration and residence registration available online. This will help to ensure easy access to registration services and faster and more efficient registration, bringing services closer to the people and eventually allowing for registration online will help prevent the disruption of services during future crisis and emergency situations. Timely and comprehensive vital statistics produced from the Registrar will assist the government in setting effective objectives and responses to the crisis and shocks. The aforementioned initiatives in Cambodia cannot exclude the engagement of development partners through technical support, resources, and the sharing of international best practices. Thank you.
Thank you so much. It's good to hear about how mobile technologies have been used to reach some of the most marginalised communities there. I'm going to ask the Honourable Cabinet Secretary from Bangladesh to address the question.
So thank you very much. Actually, one of the important concepts we have got in this pandemic, that is called God's Act. Personally, I'm very much oriented with this concept because I was implementing a very iconic project in our country, which is called Padma project, and it has been defined by the international experts to be one of the most complex structure ever to be built on Earth. So we found every now and then that after having very precise and well-documented design and estimate, every now and then we started facing trouble and trouble and trouble. Because Padma is such a river which cannot be actually brought under any kind of discipline. So every now and then we had destruction, we had to go for new design, new plan, new program. So I was also involved in some other mega project implementation. So I have this concept, but the country and the nation has learned that there is an event called God's Act. The whole world got it in 1928 and 29 when the world experienced the Great Depression. But I think after that, nobody experienced this much. So this actually pandemic has led us to learn it that yes, all our plan, program and budget will be there. But at the same time, we have learned that we must have our flexibility and some reserves so that we can combat with those scenario. But in that case, CRVS, all statistics are very much important. Otherwise, it is simply not possible. And I thank ESCAP and other organizations who actually initiated this movement to go for the CRVS. We were very much involved with CRVS, but the concept of CRVS was not on the table or on the field. So it did not create that much of impact. But now everybody is on toes in our country, particularly I would say that the need of the vital statistics is absolutely imperative. So I think these have actually in totality has given us a new field and new arena to work upon. Thank you.
Thank you so much. It's wonderful to hear. And then the Honourable Minister from Lao PDR.
Thank you very much for another opportunity. Madam Moderator, esteemed panelists, ladies and gentlemen, in order to prevent the future losses and casualties, I think it's very important for the development partners and the governments of economies in this region to further strengthen our CRVS systems, to make sure that we put in place the early warning system, especially at the grassroots level, in particular, the cause of death registration, the certifications of death, and simplify the business process in order to enable the easier access for the public for the key legislation, in particular the debt legislation. I think that would be very vital. And we also look at the opportunities of making use of the digital technologies without the physical presence at the office of Registrar. Thank you very much.
Thank you very much for those comments. I'm going to turn to the Honourable Minister of Samoa.
Thank you, Moderator. Samoa was the first Pacific Island country to use the Business Process Improvement Framework introduced by UN ESCAP. The Statistics Bureau worked together with national stakeholders to review and assess the CRVS system. Samoa has completed the first stage of the framework, which reviewed and analyzed the CRVS system and highlighted a proposed redesign of the system to be more robust for daily operations and future crises. Some of the support mechanisms that we are still looking at so that it links with this are the literacy and the capacity of the people that are involved, so that they are able to establish linkages and connection with the relevant service providers that are providing the vital statistics to the country. Thank you.
Thank you so much. Thank you so much for also bringing a non-technical perspective in around the human capacity and skills as well. So it's useful for us to hear the other side of the dimensions. And then finally, I'm going to turn to the Honourable Deputy Minister from the Maldives, please.
Thank you for the opportunity once again. Our experience with the COVID-19 pandemic showed that decentralized, digital and integrated systems is the future, in contrast to manual and silo systems in providing undisrupted services during emergencies. For a country such as Maldives, which is made up of hundreds of inhabited islands, which are geographically isolated, we needed a solution to combat the new emerging health issues faced by the pandemic. And I would like to highlight the technological capabilities of Maldivians across age groups in the Maldives. Many Maldivians are technologically savvy, very tech literate. We leveraged on the high digital literacy and usage of internet services across the country to enable digital innovations to provide essential services such as teleconsultations. This proved to be the ultimate solution to combat the potential catastrophic consequences of travel restrictions and lockdowns. Based on these lessons learned as a way forward with post-recovery from COVID-19 and to mitigate future crises and shocks, we have flagged digitalization of the health sector, including a decentralized and integrated CRVS system as a national priority in the National Resilience and Recovery Plan. As of now, we have initiated decentralization and integration of the CRVS across all the inhabited islands. Thank you.
Thank you so much. It's an absolute amazing way to actually meet that challenge, and hearing about the teleconsultations is fascinating. I wish we had a little bit more time to go into a bit more detail about them, but it does sound absolutely fascinating on how you're connecting across the islands. I'm going to move on to my final question before we go to closing remarks. And my final question is around the COVID pandemic, as we all know, has demonstrated that while performing CRVS systems in normal times are already difficult, but in crisis, this is heightened even more. And so we've already started to touch on some of the key considerations in the guide for the redesign of some of the systems. So both for mature, but also for immature systems as they move towards resilience. And I've heard a little bit already about some of the key changes you're making, such as the Minister from the Maldives highlighting the importance of decentralizing and integrating systems at all levels. I would be keen to hear from the other countries a little bit more about some of those redesigns that you are making to your CRVS systems so as they move towards the future. Could I first of all turn back to the Somdet Karohom of Cambodia again, please?
Thank you very much for allowing me to answer question number 3. Ladies and gentlemen, in order to allow resilient CRVS, both mature and immature, to function in crisis and emergency situations, I would like to provide a few concepts as follows. We need to reinvigorate the notification of vital events through physical and electronic means from health facilities to competent civil registrars on vital events and that occur in health facilities and from competent village chiefs that occur outside health facilities to enable registrar to record and registration preliminary. On this particular point, I would like to inform Excellency, ladies and gentlemen, that generally we can say that the vital events have occurred within the health facility, and as I said, there is minimal occurrence outside of health facilities in Cambodia. Number 2, a grace period for, let me start again. Such notification is required to ensure that a civil register have enough information for verification and registration when the situation returns to normal. Number 2, a grace period for civil registrations should be granted. For example, Cambodia allows 30 days for birth registration and 15 days for death registration. However, our new draft law grants a grace period that is it is within our considerations to give a period of 1 year for birth and death registration. Therefore, in the event that there is an interruption in services during a crisis, people will not be penalized for late or delayed registration. We are now considering this option. Number 3, in light of the notification and information received from health facilities or competent village chiefs, civil registrars shall remind citizens to come and register. If necessary, civil registrars shall move around in their respective jurisdictions to process civil registration for those who haven't registered. Cambodia is successful in this work. And I would like to inform that this is the effective response, in the crisis situation. Number 4, in addition to the designated places for registration, we should establish more registration locations according to the practical needs and situation. For example, the locations where there are increasing vital events at refugee or makeshift camps in case of natural disasters. And number 5, it is necessary to revise and reduce some complicated procedures. Example, even if the informant lack of attached documents and minimum information, the civil registrar shall register the birth and death according to the information they have received. And at the same time, the civil registrar should give the information certain periods, should give the informant certain periods, so that the informant can provide further information. I thank you very much.
Thank you very much for outlining those very clear measures that you're taking to adjust the system in response to what you've learned there. I'm now going to pass over to the Honourable Cabinet Secretary from Bangladesh.
Thank you very much. This is the 39th year of my service in the government, and I never felt the importance of statistics so much, which I actually experienced during the pandemic. So I must say that this actually pandemic brought up a tremendous cooperation in the mind of the government officials as well as the politicians and the general people. So everybody came forward to give maximum service or render maximum service to the development of the nation. This was a unique sight in the whole pandemic. And of course, we have got success. We have got a lot of innovations during the pandemic. But at the same time, we also had the sufferings, no question about it. So we have learned it, that it is not only all good things, but at the same time, we also have some odd things. So we also had international cooperation with the cooperation and came forward how to give our success to them whenever we are asked about it, how we could contain our COVID situation in a tolerable scenario, although this is a massively populous country. And at the same time, we also expressed our sufferings to them, and we got the prescription from them. So the share of the experience with local and international community was a key factor in our comparatively less devastation. And another thing was that throughout our life, it took a long effort to motivate people, but this time it was so easier. Everybody came forward and took it, whatever, what good things were actually expressed to them. And another important thing was that more and more financial and administrative authorities were actually delegated to the grassroots level. So they could take a lot of strong and important decision, and also were able to spend whatever they needed. That was absolutely a very fundamental one in combating the pandemic. And for that, the vital statistics, again I come back, was a fundamental, because nobody actually gave any concession to that one. And our IT sector has become much more effective and much more people's oriented and much more beneficiary to the all sectors of the country. And huge program, I mentioned you all huge financial program, package program, which was declared by our Honourable Prime Minister, actually was a backbone to actually face this kind of terrible disaster, particularly production, employment, export, livelihood. And this huge package program was totally based on the CRVS and national ID system. So I must recognize and confess this was a fundamental one. But at the same time, I go back to my another important aspect, that we must have mutual exchange of best practices, learning experiences of the member states to redesign our resilient CRVS system. Thank you.
Great, thank you so much. The common theme of actually deprioritising, going down to the local level, is really coming out in our discussion today. So thank you so much for those comments. And now to the Honourable Minister of Lao PDR, please.
I would like to extend my sincere thanks. First of all, I would like to pay my respect to the moderator, distinguished participants, ladies and gentlemen. To ensure that CRVS system is stable and resilient, the Lao PDR need to modernize our system into electronic system and use innovation and information communication technology and new technology, especially for the civil registration and vital statistics in an electronic manner, and the notification of vital events in electronic manner, registration and certification in online process, and move toward using innovation and into providing services using electronic tools, into finding the causes of death, as well as using ID code for the cause of death. Thank you.
Thank you so much. Digitalisation, technology, innovation is obviously very critical as we move forward around CRVS and how communities engage with CRVS. So that's very good to hear. And then I'm going to move to the Minister, Honourable Minister of Samoa, please.
Thank you. We seem to offer similar ideas on this question, and Samoa is likewise the same. Although our first point is on the legal framework, and there seems to be a need to review the legal framework to be more resilient, to take into consideration the proposed changes to the system. The other one is that the decentralization that our other colleagues have mentioned. We're also looking at assessing decentralization of the services, the use of the existing mechanisms and government initiatives through district council office to decentralize registration services for ease of access. We are also looking at incentivizing the system, providing incentives for registration to ensure events are registered within the required time frame. So it's like instead of someone paying, we are looking at paying for a newborn, so that then that's an incentive for people to come and register if they know that they are getting some sort of funds from there. Then the last one is the digital solution, digitization of records for safekeeping and having secured backups as contingency, streamlining CRVS process and the use of technology to do online registration. I would like to also emphasize, as I had previously mentioned, the need to enhance literacy and the capacity of the people so that they are able to absorb. And also encouraging of the use of technology, not only for this one, but for other uses, so that they are attracted to it, so that they are able to use technology as another form of economic opportunities for them. With that, thank you very much.
Thank you very much. That's very comprehensive. And then finally, to the Honourable Deputy Minister of the Maldives, please.
Thank you for the opportunity once more, Madam Moderator. We were actually in the process of rolling out a new digital CRVS system in the Maldives when we were hit with our first wave of the COVID-19 pandemic. As our Minister of Health, His Excellency Ahmed Nassim highlighted in his remarks during the ministerial segment, and as I mentioned before, many of our essential services are very much reliant on the CRVS system, such as the use of the national identity cards. The COVID-19 pandemic demonstrated the urgency and acted as a catalyst for us to prioritize and speed up the decentralization and rolling out of birth and death module of the online CRVS system to all the inhabited islands of the Maldives. And I must note, as our Director of Health Information Research Division noted in her statement yesterday, all of our birth and death records are standardized as per international standards. The online system locks in the standardization and ensures data is collected in the same format so that all vital statistics and death coding is shared across the borders, and birth and death, we are able to monitor international and national indicators to including the global goals and sustainable development goals and the national and international priorities that the government of Maldives ensures. It also forced many of our government and private institutions to provide their services on digital platforms. We had the technology, however, the circumstances forced upon us by COVID-19 pushed us to become more creative and efficient in service provision. During the redesign of the CRVS system, we learned that it is important for all our stakeholders, our relevant stakeholders, to work together, keep the dialogue open across institutional borders, and take ownership of the system and harmonize the development of the system with respect to their needs. For a country-wide system, standardization, architecture, and interoperability issues need to be addressed simultaneously. For an evolving system, it should be integrated yet decentralized so that it can unify all systems, all information holistically. Based on our experience, such a system is the best solution to be utilized in crises and emergencies for geographically dispersed islands such as the ones in the Maldives. Thank you.
Thank you. That you've touched on some of the critical elements of a strong, robust CRVS system of integration, standardization, interoperable systems that can respond at pace and in real time when a crisis hits. So that's fantastic, and it seems like a lot of work has been underway in the Maldives in light of the pandemic, but also it already started pre-pandemic as well. So thank you for that. I'm very much aware that our time is pressing upon us very, very quickly. And although we would have liked to have a little bit more of a panel discussion, we're going to have to move to closing statements from the various different ministers of each country. We don't have a huge amount of time, so I would like to just suggest that if you can highlight the key facts that are the most important in your closing remarks, that would be greatly appreciated. We've had so much.
I would like to share with you is that we require to register the vital events successfully, because it is connecting to the future of each and everyone, and also each family. This is very crucial. And secondly, in order to ensure the successful registration of the vital events, we have a lot of work to carry out. And what is important, we need to have the legal framework, specific legal framework, and we need to have the precise national strategic plans. We should also have, the national framework and subnational framework. Cambodia is implementing the D&D reforms, that is the decentralization and the concentration. We are working very actively, including the work of the civil registration and registration of vital events. Thank you very much.
Thank you very much. Moving on to the Cabinet Secretary of Bangladesh.
So thank you very much. Actually, what we found that some of the things are very much needed. Actually, political commitment, good leadership, and also a very precise statistics. Otherwise, it is not possible to handle this kind of disaster scenario. And what we experience that as Homo sapien, we have one of the important characteristics is the adaptation, and we found it to be really true. And it became true because we could give massive package program to the general people, and that was possible only we have the statistics. So we have to make it much more realistic and usable. Thank you.
Thank you very much. It's wonderful. Moving on to the Honourable Minister of Lao PDR, please.
I would like to extend my sincere thanks. It is of my honor to hear the remarks from the ministers and the summaries from the ministers on the important matters in this discussion for this afternoon. As for Lao PDR, the first important matter, we will continue to strengthen and improve the legal framework and the relevant legislation to use as a reference to see for review registration and vital statistics system. Secondly, we will continue, and currently we under the process of implementing the application of information technology and modern technology into CRVS system. But most importantly, the third important matter, I would like to reiterate this matter. Even though we have modernized system, but our population are not aware or do not have an understanding or do not prioritize the civilization. If that's the case, we will not be able to achieve our target. Therefore, Laopedia prioritize the sharing of information and raising awareness of CRVS so that all Lao population and citizens are aware and have a sound understanding and take ownership to actively contribute into CRVS or civil registration system. Thank you very much.
Thank you very much. Moving on to the Honourable Minister from Samoa, please.
Thank you, Moderator. Despite the short time that we have shared, it has been quite a learning experience for me and for our small country in the Pacific. And although we are COVID-free, we should still be attentive to the impact, especially to our people. Samoa commits to our collective vision for universal and responsive civil registration and vital statistic systems that facilitate the realization of rights and support good governance, health, and sustainable development. We encourage enhanced cooperation among our member states so we can advance efforts for the implementation of the 2030 agenda to ensure no one is left behind. And for that, we thank you very much.
Thank you very much. And then the Honourable Deputy Minister from the Maldives.
Thank you, Madam Moderator. I would like to conclude by stating that Maldives places a lot of importance on digitalization and ensuring our health systems talk to each other to make systems more efficient. Our team at Health Ministry has a rich bank of health information, and did not let the pandemic stop us from publishing statistical information through Maldives health statistics publications and the Maldivian health profiles, because we place a very huge importance on sharing information with the public on an annual basis. Maldives has also pushed forward with the National Statistics Bill and the National Birth and Death Registration Bill amendment, which is currently in the Parliament and is currently in the process of developing our health information bill. So we place a lot of importance on vital statistics and civil registration. To conclude, I would like to say that we could not have proceeded forward without the support from our partner agencies in developing our civil registration and vital statistics system, and it is crucial that this support continues as small and developing states such as us require further assistance in streamlining our systems. I look forward to working with all of our agencies, with all of our partners and countries in pushing forward and working towards a shared vision in establishing proper and streamlined civil registration systems. Thank you.
Thank you, Honourable Deputy Minister. It's a great way to end the conference in actually talking about the important role that collaboration, partnerships, the shared vision needs to play in how we take CRVS systems forward in the Asia Pacific. That is going to be essential to all success. We've heard a lot about the importance of legal frameworks, the importance of technology, the decentralization of services so that they are closer to those people who need to be registering their events on a regular basis, and the importance of integration of systems across government as well, so that information is being shared, but there is also clear skills, capacities and data literacy to be able to interpret and use the information that is coming out for decision making, so that the linking back to administration of social protection schemes, moving quickly towards vaccination programs, all underlies the importance of a strong, robust civil registration system. It's been an absolute honour to moderate this panel. For me, this early morning, but for you all in the afternoon. We have heard of so many interesting challenges that you have faced and have overcome and are overcoming as you move forward as well. Esteemed panelists, colleagues and friends, this concludes our Ministerial Roundtable discussion today. It has been a pleasure to speak with you all today, and I hope that our attendees have taken some valuable information away from this panel this afternoon. A big thank you for your time, and I hope you go on to enjoy this conference and it is a successful, productive and energizing conference for us all. Thank you so much and good afternoon.
Excellencies, distinguished delegates, welcome back to the ministerial segment of the second Ministerial Conference on Civil Registration and Vital Statistics in Asia and the Pacific. We will now consider Agenda Item 11, the importance of civil registration and vital statistics and legal identity for all to accelerate progress on the 2030 Agenda as presented to you in documents ESCAP/MCCRVS/2021/4, ESCAP/MCCRVS/2021/6, ESCAP/MCCRVS/2021/7. A number of information documents are also provided for this agenda item. They are listed in the annotated agenda. Before we start discussing this agenda item, may I invite Ms. Deborah Kamini, UNICEF Regional Director for East Asia Pacific, to introduce this agenda item. Ms. Kamini, you have the floor.
Distinguished delegates, ladies and gentlemen, on behalf of UNICEF, UNDP, UNHCR, the World Bank, and ESCAP, it is an honor to be with you today and introduce Agenda Item 11 and present the background documentation for this session on the importance of civil registration, vital statistics, and legal identity for all. Strengthening civil registration and vital statistics system in and of itself is part of the Sustainable Development Goal number 16 on peace, justice, and strong institutions. But also 67 SDG indicators benefit from civil registration and vital statistics data, which can be used to monitor progress towards several targets and indicators. They also provide the necessary documentation and proof of legal identity for service access and are critical for disaster preparedness and response. Getting the right information to the right people at the right time saves lives and reduces losses while also strengthening people's resilience to disaster. It is notable the strong commitment we have from governments throughout this region to reach both the targets set in the Decade of Action and in the SDG. Significant gains have been made, benefiting tens of millions of people, for which you should be congratulated. However, few countries in Asia and Pacific have achieved universal birth and death registration. Also, disaggregated estimates from household survey data suggest that for many countries in the region, it is often the poorest and the most vulnerable people whose birth and death is not registered. Women and girls throughout Asia and the Pacific still face disproportionate barriers to register their children, but also their marriage and their divorce. In particular, the under-registration of marriage and lack of vital statistics on marriage make it difficult to enforce legislative improvements and track national targets to tackle the still high levels of child, early, and forced marriage that are observed in the region. Similarly, significant gaps also exist for divorce registration, which is also critical for addressing systematic gender-based violence, as well as the registration of women's death, which is necessary for adequately informing policies on perinatal and maternal care, preventing intimate partner violence, and ensuring access to economic assets. Civil registration also plays a central role in the establishment of a well-functioning identity management system. The conferring of legal identity is a function of ongoing universal civil registration. The two go hand in hand. However, systems for civil registration and legal identity have been hard hit by the COVID-19 pandemic, restricting access for many, but also showing us how innovation can help to reduce barriers to services and increase coverage, including for marginalized and hard-to-reach populations. To support the achievement of the Sustainable Development Goal 16.9, legal identity for all by 2030, the United Nations adopted in 2020 the United Nations Legal Identity Agenda. It aims to develop a coherent and integrated response to the issue of legal identity including birth registration, with a view to supporting member states. The UN partners here today are committed to supporting you in achieving strong, robust, and resilient civil registration and legal identity systems. Regional initiatives, including the Decade of Action and the commitments made by your governments to the Regional Action Framework, are vital for progress, as are the vibrant sub-regional networks of civil registers and partners, including the Association of Southeast Asian Nations' work on preventing statelessness, the civil registration professionals of South Asia, made up of 8 countries in South Asia, and the Pacific Civil Registers Network, active since 2014. These networks provide peer support, they share learning, and together champion change, positive change. Today, we propose 10 opportunities for accelerated action to ensure that legal identity from birth to death is founded on civil registration. These opportunities can be found in the background paper for this session that provides a call to action for us to work collectively, governments, UN partners, civil society, and private sector, to accelerate progress and reach our shared goal of legal identity for all. These opportunities include the implementation of the United Nations Legal Identity Agenda, which provides a roadmap for accelerating action, strengthening of regulatory frameworks for the linkages between civil registration and identity management to make the entire system inclusive, transparent, and free from access barriers that affect hard-to-reach and marginalized groups. Also, investing in safe and innovative technological solutions to enhance access to civil registration and identity management systems, including mobile technology, and engage and empower communities to demand birth registration and legal identity for all, and promote the full inclusion of marginalized and poor communities and the prevention of statelessness. Political commitment and leadership are critical. They are critical as your role as leaders can greatly accelerate progress. To conclude, I would like to remind us all that in adopting the regional framework for action, we have all committed to universal and inclusive systems that support individuals in exercising their human rights and accessing basic services. By working together, I'm confident we can reach our targets by the end of the Decade of Action in 2025 and fulfill our joint vision of a region, the Asia and Pacific region, where every person has a legal identity based on the foundation of a strong system for civil registration. I now invite country representatives to share your views, encouraging you to reflect on accelerating action and ensuring that no one is left behind. Thank you.
Thank you, Ms. Kamini, for the introduction of the agenda item. I now invite any comments on agenda item 11 from the floor. I request all delegations to keep their interventions to no more than 3 minutes. The first speaker on my list is His Excellency Mr. Karen Andresyan, Minister for Justice of Armenia, to be followed by His Excellency Mr. Balkrishna Khant, Honourable Home Minister of Nepal. Your Excellency Mr. Karen Andresyan, you have the floor.
Distinguished colleagues, ladies and gentlemen, the Republic of Armenia expresses deep gratitude to all the organizers and co-organizers who have made their contributions to organizing the second Ministerial Conference on Civil Registration and Vital Statistics in Asia and the Pacific. Today, the introduction and improvement of the CRVS and legal identity systems are one of the priority objectives in the whole world. Truly sustainable CRVS and legal identity systems are necessary for all the goals that are predetermined in the SDG and aimed at ruling out poverty and improving the quality of life in the whole world. The efficient operation of the systems is particularly important within the framework of point 16.9 of the Agenda 2030. Due to the effective activities of these various systems, we will be able to have a real assessment on the successful achievement of the SDG goals. The linking and operability of the CRVS and national ID management systems are the most important challenge for all states. In case of the real cooperation, whereof we will all be able to provide every person with an identification document and make him or her visible for the state and the world, due to which every person will be able to enjoy his or her rights and freedoms to the fullest extent. In order to achieve this goal, each of us must display political will and assume the commitment to develop, introduce and continuously enhance the CRVS and national ID management systems in our states. Moreover, it is obvious that the linking and operation of these systems may bring about problems of different levels in different countries, starting from limited administrative, financial and technical capacities, absence of high technologies, and ending with a lack of interagency coordination. However, the key starting point for each of us must be the very fact that in case of existence of active systems, we will create an opportunity for every individual to use public services, have bank accounts, travel, seek legal protection, and solve numerous other issues. The existence of an identification document is of fundamental significance for every individual, and we must all, with unanimous forces, double our efforts in order to achieve the target set under point 16.9 of the Agenda 2030. The development of the CRVS and national ID management systems is a priority of the government of the Republic of Armenia, as it is impossible to ensure the improvement of the demographic situation, protection and promotion of public health, establish precise and effective social programs without the existence of precise data on vital events such as birth rate, natural growth of the population, mortality indicators, and their causes. In this sector, the key role is given to the Civil Status Act's registration itself. Today, Armenia has the honor of introducing a fully digitalized service for registration of status acts, which, within the information it contains, is the pillar based on which the legal and secure identity system is formed. The programs of the government of Armenia aimed at the protection and ensuring of human rights and freedoms are formed on the basis of the results of this interagency cooperation. Year after year, taking into account the permanent monitoring of the CRVS and national ID management systems, the government submits several draft laws and secondary legislative acts aimed at the development of these sectors and meeting the demand of our population. Due to the linking and operability of the e-governance systems for civil registration and the electronic system of the State Population Register, each child is issued a social services number during registration of the birth thereof, which makes the child visible for the state and for the future effective protection of his or her rights and freedoms guaranteed by the state, starting from physical protection, issuance of an identification document, and ending with the ensuring of the right to education. The ongoing enhancement of the CRVS and national ID management systems enable us to claim that there is an opportunity to make progress in numerous directions of the Agenda 2030 and completely ensure point 16.9, which envisages providing everyone with identification documents, including birth certificates for every child in 2030, as well as implementing the actions provided for by point 17.19, which is directly related to the CRVS system. Armenia expresses its commitment to continue the enhancement of the CRVS and national ID management systems, thereby providing every child with a birth certificate and every person with an identification document, as well as expresses its readiness for exchange of experience with all the states that are just beginning to build their respective CRVS and national ID management systems at the moment. Let me express again my gratitude for the opportunity to participate, which will contribute to the future and long-term cooperation, which in its turn will allow enhancing and improving the CRVS and national ID management systems based on the exchange of the best practices. So let's get everyone in the picture.
Thank you, Minister Karen Andresyan from Armenia. Next on my list is His Excellency Mr. Balkrishna Kant, Honourable Home Minister of Nepal, to be followed by His Excellency Mr. Manuel Carceres da Costa, Minister of Justice from Timor-Leste. Your Excellency Balkrishna Kant, the floor is yours.
Honourable Chairperson, distinguished delegates, ladies and gentlemen, First of all, I would like to thank ESCAP for successfully organizing this second ministerial conference on civil registration and vital statistics in Asia and the Pacific. This empowers member states to expand coverage of CRVS that acts as an accelerator for implementing the 2030 Agenda for Sustainable Development, ensuring no one is left behind. Honourable Chair, today we are together to celebrate the achievement of the first half of the Asia and Pacific CRVS decade and to cope the remaining challenges. At this moment, I would like to take this opportunity to share some of the achievement that Nepal has made so far in strengthening the CRVS system. We have recognized the CRVS program as one of the transformative programs of the nation. This system is expected to mainstream the implementation of the fundamental right to health, education, employment, social protection, and various government services that are enshrined particularly to children, youth, women, elderly citizens, and socially disadvantaged people. With enough legal arrangement, we have provision for local registrars offices at each unit of the local government nationwide and the Central Register, a Department of National Identity and Civil Registration. The department has developed and operated on online vital events registration and social protection management information system. We are planning to integrate various government services such as national identity card, passport, social protection scheme, employment opportunities, health insurance, and many more with the system. The government has also endorsed CRVS strategy 2019 in line with the regional action framework on the CRVS in Asia and Pacific. In the meantime, we are facing challenges such as critical geographical location, hindering the easy access to civil registration, skilling of human resources to adopt new technologies, and ensuring adequate financial resources to strengthen CRVS system. Despite that, we are committed to achieve the set goal and the principles enshrined in the Ministerial Declaration. We will continue enabling our system of CRVS to ensure the universal vital events registration. Furthermore, joint collaboration in this regard will expedite to momentum to achievement our shared goal. Thank you all. Namaste.
Thank you, Honourable Home Minister of Nepal. Next speaker is His Excellency Mr. Manuel Carceres da Costa, Minister of Justice of Timor-Leste. You have the floor, sir.
Excellency Chairman, Excellencies, Head of Delegations. Firstly, I would like to express my sincere gratitude to ESCAP and other organizing committee for having Timor-Leste in this second ministerial conference. On behalf of the government of Timor-Leste, I would like to share with you all on the significant achievement made after the first ministerial conference held in Bangkok back in 2014. A specific achievement of the implementation of CRVS in Timor-Leste is highlighted as follows. Legislations and a CRVS strategic plan. To establish a comprehensive CRVS system and to ensure its implementation, many relevant legislations have been put in place in the country, such as Civil Code and Law Number 10/2011 of 14 September is a legal foundation to implement civil registration in Timor-Leste. Civil Registry Code, which complements the existing law and specifies further details of civil registration, is in the National Parliament for further discussions prior to its approval. Organic Law of Directorate General of Civil Registration and Notary, number 38, 2019, on the establishment of civil registration office in municipalities. The CRVS strategic plan to guide the implementation on CRVS in the country is currently being drafted and aimed to be presented to the Council of Ministers for approval in early 2022. Civil registration services. To provide an adequate CRVS service to all Timorese, a number of efforts have been made to bring the service close to the community, highlighted as follows. Civil registration offices have been established in all 12 municipalities and in the special administrative region of Alisjahbana. The government aims to expand civil registration office in sub-municipalities level across the country. Demography Management Information System, the MIS, was installed in 2010 and officially launched in 2014. On the MIS, 502,164 people, or 42% of the population, is recorded to have been registered at birth, out of which 46,608 or 9% are children under 5 years old. The Ministry of Justice is advancing on online data management in civil registration to realize timely data collection at less cost. For example, civil registry offices in municipalities are connected online with the central data system of the ministry. The government established birth registration posts in hospitals and some health centers in 11 municipalities to facilitate timely registration of births carried out in these health facilities. The government, in partnership with partners, conducted a mobile birth registration campaign to facilitate birth registration of children living in remote villages and sub-villages that are far away from municipality capitals where civil registry offices are located. CRVS staff in a statistic office based at the municipality level have a remit to visit at least one village every month to conduct a registration or collect the forms which filled in villages. Coordination mechanisms. To ensure all the involved institutions to effectively collaborate and monitor the progress of CRVS implementation, the establishment of coordination mechanism in other words. The Minister of Finance, Minister of Justice, Minister of Health, and Minister of State Administration has come together and formed a CRVS committee shortly after the first ministerial conference, which is yet to be approved. The committee members defined responsibilities of each ministry. The CRVS committee aims to hold coordination meetings regularly to discuss issues related to CRVS, monitor progress, and collaborate on implementing CRVS system, including finalization of CRVS strategic plan, capacity building, enhancing knowledge and practice of the frontline workers of CRVS implementation, all the community leaders in the country and midwives or health officers has been trained on birth registration procedure to register children who are born in Timor-Leste, including training on CRVS data collection, publication, and CRVS data. The population data down to village level is published by the Directorate General of Statistics 2 years based with a process system and instrument for data collection of reported births and deaths are in place. The estimation of population data, along with deaths and the immigration data, are utilized to produce an estimate of population size and count the births at all geographical levels at twice-year basis. Awareness raising, continuous sensitizing, civil registration, and CRVS services to population in the country through appropriate channels such as community radio and national TVs. Apart from the achievement presented, there are some challenges in the CRVS implementation process. The challenges as follows: lack of common vision among different ministries on the implementation of CRVS in the country, lack of interministerial collaboration on civil registration data, existence of parallel systems, and this duplicative effort in data collection. Envisioning the future, there are some works need to be completed to implement CRVS in the country as follows: finalize and approval civil registration code as a legal foundation to implement civil registration in the country. Finalize and approval of CRVS strategic plan. Finalize a resolution on establishment of a National Steering Committee in the capacity of providing direction, oversight, and mandate of CRVS system in Timor-Leste, strengthening the role of the Steering Committee to coordinate, oversee, and monitor CRVS implementation, to establish data exchange protocol between line ministries sharing relevant CRVS data for publication purposes, improving coordination across line ministries to follow up on the completeness and coverage issues across the country. Thank you for your attention.
Thank you, Minister of Justice of Timor-Leste. Next speaker is Honourable Mr. Samui Kuita Waipulu, Minister of Justice and Prisons of Tonga, to be followed by His Excellency Mr. Tongchan Manisai, Ministry of Home Affairs and Home Affairs of Lao PDR. Mr. Samui Kuita Waipulu, you have the floor.
Malole and greetings from the Kingdom of Tonga. Chairman of the United Nations Economic and Social Commission for Asia and the Pacific, Your Excellencies, fellow Honourable Ministers, distinguished delegates, and gentlemen, ladies and gentlemen, allow me to deliver a statement on behalf of the Kingdom of Tonga. The Kingdom of Tonga is very much committed to accelerate the progress on achieving the 2030 agenda. Thus, the Kingdom of Tonga is supportive of a strong and robust civil registration and vital statistics system. In place, a civil registration and vital statistics is a fundamental right of every human being in Tonga, and endeavor to ensure that each and every citizen in Tonga has a legal identity. And the Kingdom is the custodian of that identity. Tonga's Ministry of Justice and Prisons, through its Office of the Registrar General, with which is solely responsible for the registration of vital life events such as births, deaths, and marriages, and the general updating of vital statistics, operates to provide a timely service throughout the Kingdom. and has implemented several important projects which include the digitization of civil rights registry records, amnesty programs to enable the free registration of unregistered births, and the validation of data project with line ministries such as the Ministry of Health and the Statistics Department. The Kingdom of Tonga maintains near universal birth registration rate of 97.7%, as confirmed by results from its latest multiple indicators cluster survey, MICS, in 2019, indicating the Kingdom's ongoing support to all the joint commitments to accelerate progress on the 2030 Agenda for Sustainable Development. On behalf of His Majesty King Tupola VI, the Honourable Prime Minister, Honourable Reverend Dr. Ifereimi, and his Cabinet, I would like to thank the United Nations Economic and Social Commission for Asia and the Pacific, and all other donor partners who have contributed to Tonga's progress on the 2030 Agenda. Best wishes to all participants, and may this ministerial conference further strengthen our respective commitments and cooperation towards achieving the 2030 Agenda. Mahalo.
Thank you, Honourable Minister of Justice and Prisons of Tonga. Next speaker is His Excellency Mr. Thongsana Manisai, Minister of Home Affairs of Lao People's Democratic Republic. You have the floor, sir.
Ladies and gentlemen, on behalf of Lao PDR delegation, I would like to congratulate all delegates to this meeting for their contribution in reviewing progress made in the implementation of commitments given in the Ministerial Declaration, Get Everyone in the Pictures, signed in 2014, and the implementation of the Regional Action Framework towards reaching the goals of the Civil Registration and Vital Statistic, Decade 2015-2024. Congratulations to all the countries that have succeeded significantly in achieving their CRVS targets in the first half of the decade, despite global difficulties and many challenges faced, such as COVID-19 pandemic, natural disaster, and global economic difficulties. Ladies and gentlemen, in order to achieve SDGs and realize the Laos government vision by 2030, citizen rights will be guaranteed by the law. By 2025, Lao citizens will complete at least secondary school. Lao population will have access to universal health coverage. The average life expectancy will be higher than 73 years old, and the labor force is developed in quantity and quality. Lao PDR has defined strategy, amended related law and regulation, and set up coordinating mechanism with Ministry of Home Affairs as a focal point within the country and within the region. Currently, Lao PDR is intensively implementing priority programs defined in the strategy and disseminating the law and regulation for CRVS system improvement. Ministry of Home Affairs is building an electronic CMIS, sharing data with the line ministry to ensure completeness, accuracy, and on-time availability of information for civil registration-based vital statistic production and on-time statistic dissemination. In the first half of the decade, the national coverage of registration of births in Lao PDR was 43%, and that of death, 37%. The civil registration system is not yet universal and electronic, and as a result, vital statistic production is not yet complete, and vital statistic was not disseminated on time. However, Lao PDR will do its utmost to achieve its established targets and universal coverage of civil registration countrywide, so that all citizens in the country, regardless of gender, age, and ethnicity, could have access to civil registration without leaving no one behind. We believe that the development of electronic CMIS in process will provide us complete, accurate, and timely civil registration data and vital statistics by the end of the decade for the implementation of UN 2030 agenda on legal identity for all. Lao PDR welcomes lessons and experience from countries that have succeeded and will continue to cooperate and accept technical and financial support from ESCAP member states, development partners, and international organizations for accelerated improvement of CRVS system in Lao PDR in order to meet international standards and modernization to ensure availability of data of good quality for effective and efficient socio-economic development planning. On behalf of Lao government, I reaffirm that by 2024, with the ownership of Lao government, together with support from development partners and international organizations, Lao PDR will try to meet its target for birth registration and certification of at least 70%. Lao government believes that the ministerial declaration of this second ministerial meeting and the regional action framework will further contribute to the implementation of the declaration, get everyone in the pictures in Asia and Pacific without leaving no one behind, and the 2030 agenda. Finally, on behalf of Lao government, we are pleased to endorse the content of the ministerial declaration of this second ministerial meeting as presented at this meeting. Thank you.
Thank you, Minister of Home Affairs of Lao PDR. Next speaker is His Excellency Mr. Chandar Mao, Secretary of State of Ministry of Interior of Cambodia, to be followed by Mr. Jumai Sapa, Deputy Minister of Justice of Turkmenistan. Mr. Chandar Mao, you have the floor.
Armida Salsiah Alisjahbana អគ្គលេខាធិការរងនៃអង្គការសហជីវជាតិនិងជាប្រធានប្រតិបត្តិនៃអង្គការ ESCAP ឧត្តមប្រធានឧត្តមលោកជំទាវលោកស្រីអស់លោកថ្ងៃនេះតំណាងឲ្យរាជរដ្ឋាភិបាលកម្ពុជាខ្ញុំសូមសម្ដែងនូវការគាំទ្រនិងអបអរសាទរជូនចំពោះគណៈកម្មការសេដ្ឋកិច្ចនិងសង្គមសម្រាប់តំបន់អាស៊ីនិងប៉ាស៊ីហ្វិករបស់អង្គការសហជីវជាតិដែលបានរៀបចំសន្និសីទដ៏មានសារៈសំខាន់លើកទី2ស្តីពីការចុះបញ្ជីអត្រានុកូលដ្ឋាននិងស្ថិតិអត្រានុកូលដ្ឋាននាឱកាសនេះរាជរដ្ឋាភិបាលកម្ពុជាមានការបដិញ្ញាចិត្តយ៉ាងមុតមមក្នុងការសម្រេចឲ្យបានគោលដៅសហសវត្តនិងផែនការសកម្មភាពស្តីពីអត្រានុកូលដ្ឋានស្ថិតិអត្រានុកូលដ្ឋានក្នុងតំបន់អាស៊ីនិងប៉ាស៊ីហ្វិកឆ្នាំ2015-2024ប្រកបដោយនិរន្តរភាពការអភិវឌ្ឍដែលកាន់តែមានសមធម៌ប្រកបដោយបរិយាបន្ននិងកាន់តែផ្ដោតទៅរកប្រជាពលរដ្ឋហើយដូច្នេះហើយនៅក្នុងខែមិថុនាឆ្នាំ2016រាជរដ្ឋាភិបាលកម្ពុជាបានអនុម័តផែនការយុទ្ធសាស្ត្រជាតិស្តីពីអត្តសញ្ញាណកម្មរយៈពេល10ឆ្នាំ2017-2026ផែនការយុទ្ធសាស្ត្រជាតិនេះមានចក្ខុវិស័យផ្ដោតលើសកម្មភាពជាអាទិភាពការតម្រង់ទិសទៅរកការផ្ដល់សេវាកម្មល្អនិងការធ្វើទំនើបកម្មលើវិស័យរដ្ឋបាលសាធារណៈដែលអាចគ្រប់គ្រងបាននៅទិន្នន័យអត្តសញ្ញាណបុគ្គលទិន្នន័យព្រឹត្តិការណ៍ជីវិតនិងផលិតបានស្ថិតិប្រជាជននិងស្ថិតិអត្រានុកូលដ្ឋានប្រកបដោយភាពជឿទុកចិត្តគណៈកម្មាធិការជាតិដឹកនាំតម្រង់ទិសការងារអត្រានុកូលដ្ឋានស្ថិតិអត្រានុកូលដ្ឋាននិងអត្តសញ្ញាណកម្មបានត្រូវបានបង្កើតឡើងដើម្បីតាមដានជំរុញនិងពន្លឿនការអនុវត្តផែនការយុទ្ធសាស្ត្រជាតិនេះឲ្យសម្រេចបានប្រកបដោយប្រសិទ្ធភាពខ្ពស់តាមចេញពីយុទ្ធសាស្ត្រជាតិនេះកម្ពុជាបានកែលម្អដំណើរការប្រព័ន្ធចុះបញ្ជីអត្រានុកូលដ្ឋានតាមរយៈការកែសម្រួលនីតិវិធីក្នុងការចុះបញ្ជីជូនគ្រួសារនីមួយៗដើម្បីបង្កលក្ខណៈកាន់តែងាយស្រួលកាត់បន្ថយបែបបទស្មុគស្មាញមួយចំនួននិងមិនយកកម្រៃសេវាលទ្ធផលវឌ្ឍនភាពដែលគួរឲ្យកត់សម្គាល់អត្រានៃការចុះបញ្ជីកំណើតបានកើនពី73% នៅឆ្នាំ2014មកប្រមាណ 87% នៅក្នុងឆ្នាំ2020ប្រទេសកម្ពុជាបានសហការជាមួយមូលនិធិ Bloomberg Philanthropy តាមរយៈអង្គការ Vital Strategy យើងបាននឹងកំពុងអនុវត្តគម្រោងព្រួយដើមស្តីពីទិន្នន័យសុខភាពក្រមកម្មវិធីពង្រឹងប្រព័ន្ធអត្រានុកូលដ្ឋាននិងស្ថិតិអត្រានុកូលដ្ឋានតាមរយៈការអភិវឌ្ឍគុណភាព នៃការចុះបញ្ជីកំណើតនិងមរណភាពរួមទាំងមូលហេតុនៃមរណភាពបានពង្រឹងនិងប្រមូលទិន្នន័យសម្រាប់គោលនយោបាយនិងរៀបចំផែនការកម្មវិធីព្រមទាំងសមាជិកដទៃទៀតដែលប្រព័ន្ធទិន្នន័យពាក់ព័ន្ធនឹងជំងឺមិនឆ្លងនិងជំងឺមហារីកទន្ទឹមនេះកម្ពុជាបានពិចារណាដោយយកចិត្តដាក់ចំពោះជំរឿននានាដោយបានបញ្ញាពិនិត្យនិងកែសម្រួលក្របខ័ណ្ឌច្បាប់នានាសម្រាប់ការងារអត្រានុកូលដ្ឋានស្ថិតិអត្រានុកូលដ្ឋាននិងអត្តសញ្ញាណកម្មជាតិក្របខ័ណ្ឌច្បាប់នេះនឹងជួយកម្ពុជាក្នុងការកសាងឈ្មោះទៅរកការអនុវត្តនិយមអន្តរជាតិដ៏ប្រសើរឡើងនិងការអនុវត្តល្អក្នុងការភ្ជាប់ប្រព័ន្ធគ្រប់គ្រងអត្តសញ្ញាណជាមួយនឹងប្រព័ន្ធអត្រានុកូលដ្ឋានដែលអត្តសញ្ញាណបុគ្គលត្រូវបានបង្កើតឡើងនៅពេលចុះបញ្ជីកំណើតរស់និងត្រូវប្រើប្រាស់រហូតដល់បុគ្គលនោះទទួលមរណភាពប្រព័ន្ធដ៏មានប្រសិទ្ធភាពទាំងពីរនេះនឹងធានាថាកម្ពុជានឹងទទួលបានផលប្រយោជន៍ពីព័ត៌មានប្រជាជនហើយនឹងប្រើប្រាស់ព័ត៌មាននោះដើម្បីបម្រើឲ្យការរៀបចំផែនការយុទ្ធសាស្ត្រនានាទាំងនៅថ្នាក់ជាតិថ្នាក់ក្រោមជាតិឆ្លើយតបទៅនឹងតម្រូវការពិតប្រាកដរបស់ប្រជាពលរដ្ឋជាពិសេសឆ្លើយតបចំពោះជនដែលត្រូវការបំផុតនៅក្នុងដំណើរការនៃការអភិវឌ្ឍក្របខ័ណ្ឌច្បាប់និងលិខិតតេតាំងក្របច្បាប់អំពីអត្រានុកូលដ្ឋានស្ថិតិអត្រានុកូលដ្ឋាននិងអត្តសញ្ញាណកម្មថ្មីនេះកម្ពុជាបានធ្វើការសម្រេចចិត្តប្រកបដោយមនសិការខ្ពស់ក្នុងការធានាជាសកលនិងអចិន្ត្រៃយ៍ដែលនឹងអនុញ្ញាតឲ្យប្រព័ន្ធចុះបញ្ជីកំណើតរស់និងមរណភាពអាចប្រព្រឹត្តទៅបានយ៉ាងល្អបំផុតនៅក្នុងទឹកដីនៃប្រទេសកម្ពុជានិងធានាថាអត្តសញ្ញាណកម្មស្របច្បាប់នឹងត្រូវបានបង្កើតឡើងចំពោះមនុស្សគ្រប់រូបចុងក្រោយនេះខ្ញុំសូមបញ្ជាក់ថារាជរដ្ឋាភិបាលកម្ពុជាគ្រប់គ្រងចំពោះសេចក្តីថ្លែងការណ៍សន្និសីទថ្នាក់រដ្ឋមន្ត្រីអាស៊ីនិងប៉ាស៊ីហ្វិកលើកទី2នេះនិងក្របខ័ណ្ឌសកម្មភាពថ្នាក់តំបន់ដើម្បីសម្រេចបានគោលដៅអភិវឌ្ឍប្រកបដោយចីរភាពឆ្នាំ2030សូមអរគុណ
Thank you, Secretary of State, Ministry of Interior of Cambodia. Next speaker is Mr. Jumaev Sapa, Deputy Minister of Justice of Turkmenistan, to be followed by Mr. Andy Kalo, Director of Department of Civil Registry and Vital Statistics of Vanuatu. Excellency, Mr. Jumaev Sapa, you have the floor.
Добрый день, господин председатель, добрый день, уважаемые дамы и господа. Пользуясь случаем, хотел бы поблагодарить вас за организацию такого масштабного и полезного мероприятия и пожелать всем успехов. Мы надеемся, что данное мероприятие на дальнейшее углубление всестороннего диалога и обмена опытом по вопросам регистрации актов гражданского состояния и статистики естественного движения населения в Азиатско-Океанском регионе. В начале своего выступления хотел бы отметить, что нейтральный статус страны неразрывно связан с правами человека. В данном контексте в Конституционном законе Туркменистана о постоянном нейтралитете Туркменистана и Декларации о международных обязательствах нейтрального Туркменистана в области прав человека закреплено, что одним из ключевых принципов туркменского государства объявление в стране прав и свобод человека в качестве высшей ценности общества и государства, приоритетность в государственной деятельности этих прав и свобод. В связи с этим одним из приоритетных направлений государственной политики государства под руководством глубоко уважаемого президента Туркменистана Гурбангулы Бердымухамедова в соответствии с общепризнанными нормами международного права. Это относится и к нормативно-правовой базе, регулирующей действия граждан, оказывающих влияние на возникновение, изменение или прекращение их прав и обязанностей, а также характеризующие их положение. В этом направлении последовательно ведутся работы по совершенствованию законодательства и практической реализации его норм. В качестве примера следует отметить вступление в силу в июле 2020 года закона Туркменистана об актах гражданского состояния, принятого в 2019 году, который регулирует порядок государственной регистрации актов гражданского состояния и определяет организационную правовую основу деятельности органов, осуществляющих государственную регистрацию актов гражданского состояния. Это правовая гарантия регистрации всех детей, родившихся на территории нашей страны, независимо от положения родителей. Согласно данному закону, рождение каждого ребенка, родившегося в Туркменистане, должно пройти государственную регистрацию и должно быть выдано свидетельство о рождении. Также работы, осуществляемые в нашей стране в этой области является свидетельством эффективности реализации мер, предусмотренных в национальном плане действий по ликвидации без гражданства в Туркменистане на 2019-2024 годы, утвержденным постановлением уважаемого президента Туркменистана Гурбангулы Бердымухамедова. Иностранных граждан и лиц, не имеющих гражданства, пребывающих на территории Туркменистана, а также иностранных граждан и лиц без гражданства, гражданского состояния, которых зарегистрированы в органах ЗАГС Туркменистана и проживающих за пределами Туркменистана. Также действие закона Туркменистана об актах гражданского состояния распространяется на граждан Туркменистана, я извиняюсь, согласно статье 3 вышеупомянутого закона государственной регистрации подлежат следующие акты: рождение, заключение брака, расторжение брака, установление, удочерение, установление отцовства, перемена фамилии, имени, отчества, смерть. Данный закон предусматривает также создание единого государственного реестра записи актов гражданского состояния. Министерство АДА Туркменистана ведет большую работу по созданию единой электронной базы данных ЗАГС Туркменистана. В данное время проводится работа по разработке программного обеспечения, в котором будет осуществляться государственная регистрация всех видов актов гражданского состояния. В будущем даст создание единого государственного реестра записи актов гражданского состояния, в будущем даст возможность использования сведений реестра ЗАГС как одного из основных источников формирования реестра населения. Особенностью данной системы является конструктивное взаимодействие органов здравоохранения, органов ЗАГС, органов статистики, судебных и других органов. В заключение своего выступления хотел бы выразить, что Туркменистан уделяет особое внимание Институту регистрации актов гражданского состояния, осознает важность данного процесса и неуклонно следует взятым на себя обязательствам на международной арене. Спасибо за внимание.
Thank you, Deputy Minister of Justice of Turkmenistan. Next speaker is Mr. Andy Kalo, Director, Department of Civil Registry and Vital Statistics at Vanuatu, to be followed by Mr. Anir Chowdhury, Policy Advisor, Information and Communication Technology Division, Access to Information Program of Bangladesh. Mr. Andy Kalo, you have the floor.
Distinguished Excellencies and delegates, United Nations and development partners, ladies and gentlemen. Tropical greetings again to you all from the Republic of Vanuatu. Mr. Chairman, civil registration and vital statistics is foundational to achieving the 2030 agenda by counting everyone and making everyone visible with a legal identity. One of the foundational principles of human rights is stated in the 1948 Universal Declaration of Human Rights. All human beings are born free and equal in dignity and rights. Yet, of a legal identity and proof of identity serves as barrier to fundamental rights guaranteed by the Universal Declaration. The fundamental connections between human rights and civil registration of vital events was made when the International Covenant on Civil and Political Rights and the Convention on the Rights of the Child was stated that every child shall be registered immediately after birth and shall have a name. Vanuatu is a party to both convention and covenant. Legal identity, which itself is a right, can be first established through birth registration, and target 16.9 of the Sustainable Development Goals by 2030 provide legal identity for all, including birth registration, presents an opportunity for the government of Vanuatu to link civil registration and national identification systems. A link enabled by the national identification number as assigned to each individual at birth. For the government of Vanuatu, accurate identification of its citizens and residents facilitated the provisions of targeted services such as essential health services and social safety nets programs, but can also contribute to achieving the universal health coverage and substantial coverage of the vulnerable through social protection systems. Based on the civil registration data and the legal identity of government of Vanuatu, we will ensure that citizens can exercise their human rights provided with a legal identity, the civic rights, having access to services and education and health, and so forth, and the political right to vote. Mr. Chairman, allow me to make another intervention, which is to state that the government of Vanuatu has now passed in Parliament, and we are proud to say this, has passed in Parliament 2 legislations. The first one is the National Identity Bill. The National Identity Bill sets out a comprehensive legislation scheme for national identity cards to be issued to all citizens. The objective of this law is to provide Vanuatu with the national identity card legislation that is currently missing in the legal framework related to civil registration and identity management. In 2020, the government of Vanuatu approved the use of national ID for voting in all elections. And this is to enhance voter identification and reduce election fraud. This process of harmonizing registration systems should reduce duplication of tasks carried out by both the Civil Registration Department and the Electoral Office, and cost saving for the government. This effort of linking voting using national ID will also enable government of Vanuatu to achieve its international commitment and SDG 16.9. The other legislation passed before Parliament is the Civil Registration and Identity Management Law. The Civil Registration and Identity Management Law replaces our old Civil Status Registration Act, which commenced in 1971. This new law will provide a modern and robust legal framework for civil registration and identity management to reflect the current best practices as well as flexibility in enabling current and future technological innovation. Mr. Chairman, I thank you everyone for your listening, and may God bless you all. Thank you.
Thank you, Mr. Andy Kalu, Director, Department of Civil Registry and Vital Statistics of Vanuatu, for your statement. The last speaker on my list is Mr. Anir Chowdhury, Policy Advisor, Information and Communication Technology Division, Access to Information Program of Bangladesh. Mr. Anir, you have the floor, sir.
Thank you very much, Mr. Chair. I would like to thank ESCAP and other organizers for organizing this very timely conference despite the very challenging circumstances caused by the pandemic. Our world is becoming increasingly digital. The pandemic was the demonstration of that transformation like no other in human history. Despite the fast nature of digitization, we are still doing a lot of work in silos. From birth to death, citizens need to document the same piece of information several times and register themselves in several systems like health, education, social safety net, marriage databases, taxation, migration, and many others for recording the vital events of their life to access different public services. This scenario is noticed across the world, especially in the developing and least developed countries. CRVS and ID systems are incomplete and uninteroperable, which means they don't talk to each other. This means we're moving from analog silos to digital silos, whereas the beauty and promise of digitization is in its interoperability and integration. And that is the promise we must deliver. This requires 4 things. First, ensuring that CRVS is linked to service delivery in a meaningful way. In the last 131 years, between 1873 and 2004, only 8% of Bangladesh's population were registered. While in the last 16 years, we have covered over 80% of our citizens using digitization. That's over 100 times efficiency. The birth registration rate of children under 5 years of age stood at 20% in 2014 during the first CRVS Ministerial Conference in Bangkok, when the CRVS decade was declared. The rate experienced a sharp rise to 71% in 2019 because it was linked to primary school enrollment, a critical link to service delivery. However, during 2020, last year, the rate fell to 56% because schools were closed for 18 months. On the other hand, adoption of biometrically verified legal identity increased during the pandemic significantly because it was linked to new forms of social safety nets for the new poor who were rendered jobless by the pandemic. Vaccination registration linked to legal identity also drove up NID adoption. Recently, we started doing vaccine registration linked to civil registration, driving up birth registration for the children. This clearly shows how linking civil registration and legal identities to service delivery is the most effective approach to ensuring conformance to CRVS. Second, linking CRVS and national ID and all forms of citizens ID within the government. In Bangladesh, we're moving towards a unique ID system, which will be given at birth and will be used as national ID. Birth registration is done by the Ministry of Local Government and national ID is given by Election Commission. So integration means integration of the technical systems and organizations through a whole of government approach. We're exploring issuing unique ID during immunization, which is very successful in Bangladesh, covering over 99% of the childbirths. We're also exploring the possibility of infant biometrics using frontier technologies. Once that is done in the next few years, we hope to have biometrically verified unique ID within the first year of a child's birth, linked to services throughout the entire life cycle of him or her until death. We have a very high level coordination mechanism, which is our National CRVS Steering Committee, headed by the Cabinet Secretary of the Cabinet Division with 25 members, most of whom are permanent secretaries in different ministries dealing with different forms of IDs. Third, investing in new forms of IDs that are coming from big data and user-generated data. We have seen Togo using mobile phone usage information to identify the new poor, a form of dynamic poverty ranking. We're conducting research in Bangladesh by linking phone numbers and legal ID information. This would allow us to be very responsive in our policy decisions. The pandemic has showed us how critical it is to be responsive. We simply cannot wait for survey results only to tell us what to do, when to do it, and whom we need to serve. We, of course, have to be very careful about protecting privacy information in this regard. Fourth, linking CRVS and legal identity to SDG achievements. Target 16.9, establishing legal identity for all, including birth registration by 2030, and target 19.2, increased proportion of countries that have achieved 100% birth registration and 80% death registration, talk directly about CRVS and legal identity. But more importantly, 14 of the 17 goals, 68 of the 169 targets, and 67 of the 232 indicators are directly impacted by civil registration and legal identity. For example, ensuring preventable death to newborns and children under 5, which is SDG 3.2, social protection, SDG 1.3, assistance in dealing with shocks and disasters, SDG 1.4, empowerment of women, SDGs 5A and 5B, reducing remittance costs, SDG 10.10C, are just some of the important examples. Since all countries have made significant and visible international commitments to SDGs, linking CRVS and legal identity to SDG achievements brings dual benefits of accelerating achievement of both. In closing, I reiterate the commitment of my government to meet universal birth registration and 80% death registration by the end of the CRVS decade. In this regard, I welcome the importance of South-South knowledge sharing so that we can learn from the various best practices and not have to reinvent the wheel. Many thanks, Mr. Chair.
Thank you, Mr. Ani Chaudhry, Bangladesh. And would any other delegations from member, associate member, or permanent observer of the Commission like to raise any other matters on this agenda item at this time? I see none. So we have now come to the end of the statements by members, associate members, and permanent observers of the Commission. As time allows, I would like to now open the floor to the United Nations bodies, international organizations, and non-governmental organizations in this order. I see Mr. Indrike Ratwate, Bureau Director of UNHCR, Regional Bureau for Asia and the Pacific. Mr. Indrike Ratwate, you have the floor.
Thank you, Chair, for giving me the floor. Your Excellencies, ladies and gentlemen, in 2014, ESCAP members and associate members have embraced the shared vision of universal and responsive civil registration and vital statistic systems, which they are about to reconfirm today. This vision is at the heart of UNHCR's international protection mandate. Access to civil registration and legal identity documentation are essential for refugees, asylum seekers, returnees, internally displaced persons, stateless individuals, and persons of undetermined nationality. UNHCR stands ready to continue its support to governments in all civil legislation and legal identity issues which affect these population groups and individuals. In order to do so, we will maintain our engagement with the UN country teams and the UN legal identity working groups on the national level. And we will be honored to share our humanitarian expertise in this context. Our cooperation with the ASEAN Commission on the Promotion and Protection of Women and Children is another important partnership in this regard. We look forward to continuing the work with national authorities to translate the results of this cooperation into national activities, and thus to promote the legal identity of women and children on the ground. Regarding the assessment of inequalities affecting civil registration, I would like to recall our joint work with the Bali process on people smuggling, trafficking persons, and related transnational crime. The recent activities relating to the Bali process registration assessment toolkit have helped to identify not only the legal and practical challenges for universal civil registration, but also some aspects towards the resolution. Your Excellencies, ladies and gentlemen, let me reassure you of UNHCR's continuing commitment to collaborate with you on this important initiative. I thank you for your attention.
Thank you, Mr. Indrika Ratwata, Bureau Director, UNHCR Regional Bureau for Asia and the Pacific, for your interventions. This brings us to the conclusion of discussion under Agenda Item 11. Excellencies, distinguished delegates, we now move on to the Agenda Item 12 on other matters. Are there any other matters that we need to touch upon? I see none. Then this concludes Agenda Item 12. Distinguished delegates, let us now turn to Agenda Item 13, Adoption of Ministerial Declaration. I would now like to call upon Ms. Suzilia Binti Mod Sidek, Deputy Chief of Mission, Minister and Permanent Representative to ESCAP, Embassy of Malaysia, and Chair of the online consultations to introduce the declaration. You have the floor, Madam.
Thank you, Mr. Chair. Excellencies, distinguished delegates, please allow me on the outset to thank members states for entrusting me in the responsibility of chairing the online consultation for the draft ministerial declaration. I indeed enjoyed the honor of working with each of the distinguished delegates of the Secretariat during the online consultations. I wish to extend to them our deepest thanks for their active participation in the deliberations and for the flexibility and spirit of cooperation demonstrated right from the beginning of our consultations. Indeed, despite different perspectives, we achieved an agreement at the end of the process. I also want to acknowledge the efforts of the Secretariat throughout the 3 meetings of the consultations. I speak for the entire delegates that when I say that the support provided by them is greatly appreciated. Mr. Chair, this ministerial declaration on building a more resilient future with inclusive civil registration and vital statistics takes into account progress made since the beginning of the Asia and the Pacific civil registration and vital statistics decade and recent developments in the area of civil registration and vital statistics. It lays out clear actions to accelerate progress towards our shared vision that all people in Asia and the Pacific benefit from universal and responsive civil registration and vital statistics systems. The ministerial declaration reflects the aspiration of the region to achieve universal civil registration and will guide our work in improving civil registration and vital statistics systems in the second half of the decade. Mr. Chair, I am pleased to report that the draft ministerial declaration for adoption today has undergone a silence procedure of 72 hours. During the silence procedure, no objections were raised. It is now my honor to present to the conference the draft ministerial declaration as recommended by member states during the online consultation for consideration and adoption as contained in document ASCAP/MCCRVS/2021/L.4. I thank you and the distinguished delegates for your support and cooperation.
Thank you, Madam. I would like to express my deep appreciation to the Chair of the Online Consultations of the Ministerial Declaration, Ms. Suzilia Binti Mod Sidek, Deputy Chief of Mission Minister and Permanent Representative of Malaysia to ESCAP, for guiding the deliberations of the online consultation to a successful conclusion. May I remind all delegations that the draft ministerial declaration was circulated to all member states under silence procedure and no objections were raised. The draft ministerial conference is presented to the conference for adoption. Now the floor is open for your comments or support. I see Dr. Hamid Dirakshan, Niab, Deputy Minister of Interior and Head of National Organization for Civil Registration of Iran. You have the floor, sir.
In the name of Allah, the Compassionate, the Merciful. At the outset, I would like to express my gratitude to the Chair for his able leadership and thank warmly the Secretariat for organizing this meeting. I also would like to seize the opportunity on behalf of the government and people of the Islamic Republic of Iran to offer my deepest sorrow to the families of those who lost their loved ones and relatives due to the coronavirus pandemic. Mr. Chair, distinguished delegations, the Islamic Republic of Iran highly values the key function that ESCAP could play in achieving the defined goals for the Ministerial Conference on Civil Registration and Vital Statistics and full realization of the potential of all members within the common vision of getting everyone in the picture. Inspired by the ancient literature of my homeland, anybody who deserves a soul from God sure deserves to be counted and identified. Islamic Republic of Iran believes this is a common vision that leads us towards a comprehensive solution and better future for all nations. Mr. Chair, distinguished delegations, coronavirus pandemic showed that how important resilient and comprehensive CRVS and identification systems are. Continuity and development of common solutions will help us to improve the quality of implementation of joint programs and commitments. Mr. Chair, distinguished delegations, due to the necessity of a comprehensive and integrated global approach to the CRVS, there is a need to address and pay due attention to the impediments impairing national and international endeavors. In this regard, the unilateral coercive measures which infringe the fundamental principles of international law and principles set forth in the Charter of the United Nations remains one of the most pressing challenges and hindrances in ensuring effective international cooperation in this field. I thank you, Mr. Chair.
Thank you, Dr. Hamid Dirakhshania, Deputy Minister of Interior and Head of National Organization for Civil Registration of Iran. The next speaker on my list is Dr. Pandup Tsering, Secretary of the Ministry of Health of Bhutan. Dr. Tsering, you have the floor.
Thank you, Chair. Your Excellencies, distinguished delegates, ladies and gentlemen. We would like to sincerely acknowledge the effort put in by ESCAP in bringing up the second ministerial declaration on CRVS through a series of review and consultation with the member countries. We deeply appreciate ESCAP for its leadership and progressive role in taking forward the agenda on strengthening CRVS system in the region. The second ministerial declaration, which calls for building a more resilient future with inclusive civil registration vital strategies, is very timely. It comes at a time when the international community is grappling with the complex and evolving scenario of COVID-19 pandemic, which calls for well-functioning CRVS system more than ever to effectively guide our response to the pandemic. Bhutan, on behalf of the member states in Asia and Pacific region, has the pleasure to fully support the adoption of the draft declaration. The ministerial declaration will be instrumental for the second half of the decade for the member countries for mobilizing resources and garnering technical support required to achieve their goals of building universal and responsive CRVS by 2024. We also recognize that building universal and responsive CRVS system will not only help to overcome the challenges posed by COVID-19 pandemic, but is also critical in realizing the goals set for 2030 Agenda for Sustainable Development. Bhutan has immensely benefited for being a signatory to the first ministerial declaration and will continue to commit to this regional initiative in achieving its set goals and targets by 2024. Thank you, Mr. Chair.
Thank you, Dr. Pandup Tsering, Secretary of the Ministry of Health of Bhutan. Are there any further interventions on the draft ministerial declaration? I see none. The document ESCAP/MCC/RVS/2021/L4 is adopted. This concludes the agenda item 13. Excellencies, distinguished delegates, we will now take up the final item, agenda item 14, the adoption of the report of the conference. We have deliberated on a number of issues of significance for this region on civil registration and vital statistics during these 3 days. I note with appreciation that the cooperation of the delegations and efficient servicing by the Secretariat, we shall be able to complete all our work on schedule. It's my pleasure to present the draft report. I would like to remind that the report we are about to adopt contains 3 sections. First, matters calling for action by the Commission. Second, organization. And third, Chair's summary. Due to the exceptional nature of this year's session, the proceedings of our deliberations will be addressed as an annex to the report called Chair's summary and will be made available after the session. I now have the honor to present you the draft report for further consideration. Excellencies, distinguished delegates, we will now consider the draft report of the conference at this session. You have before you document ESCAP/MCCRVS/2021/L3, which contains the draft decisions that resulted from our deliberations on day 1 until today and is recommended for adoption. The draft report of the Ministerial Conference on Civil Registration and Vital Statistics is now presented to you for adoption. I now invite any comments on the draft report from the floor. We will commence with Section 1 on matters calling for action by the Commission. Are there any comments at this time on Section 1 of the draft report, matters calling for action by the Commission? If there are none, may I then propose that we adopt the draft decision as contained in Section 1 of the document ESCAP/MCCRVS/2021/03. I seek consensus. So let's move on to the Section 2. Organization. Are there any comments on Section 2A, opening duration and organization of the conference? I see none. The Section 2B, attendance. I see none. Section 2C, election of officers. I see none. Section 2D, agenda. Section 2E, other events. I see none. And the next section, Chair's summary. I see no comments. If there are none, may I then propose that we adopt the document ESCAP/MCCRVS/2021 is adopted. This concludes the consideration of the draft report. We now move to the closing session of the second Ministerial Conference on Civil Registration and Vital Statistics. Before I close this session, I would like to invite Ms. Armida Alisjahbana, Executive Secretary of the ESCAP, to make her concluding remarks. Madam, you have the floor.
Thank you very much, Mr. Chair. Honorable Chair, Excellencies, distinguished delegates, I'm very pleased to address the closing session of the second Ministerial Conference on Civil Registration and Vital Statistics in Asia and the Pacific. Over the last 4 days, your perspectives and engagement have identified the challenges and necessary progress required towards our shared regional vision of universal and responsive civil registration and vital statistics system in Asia and the Pacific by 2024. The Ministerial Declaration, Building a More Resilient Future with Inclusive Civil Registration and Vital Statistics, shows the continued commitments of our region to achieving universal civil registration of births, deaths, and other civic events. The Ministerial Declaration includes key areas of action that will help us progress towards our shared regional vision that will shape up the second half of the decade. Although progress needs to be accelerated, your efforts since the beginning of the decade have already changed many lives for the better. I also welcome that the Ministerial Declaration calls upon development partners to maintain or expand assistance to our member states in a coordinated manner. I recognize that member states would like us to accord priority to supporting members and associate members in the implementation of the Ministerial Declaration and the Regional Action Framework or CRVS within the context of other internationally agreed development goals and COVID-19 recovery. I'm equally delighted to note that there is a good momentum to work towards developing a resilient healthcare system, including the provision of essential health services to the people in vulnerable situations. Excellencies, distinguished delegates, in conclusion, I wish to first express deep appreciation to the statements of children and youth and civil society organizations that provided a good reminder of the critical importance of universal civil registration to the well-being of all people in the region. Building a more resilient future is critical for all of us in the second half of the Asia-Pacific Civil Registration and Vital Statistics decade. My sincere appreciation goes to the Bureau and officials of the ministerial segment of the conference for moderating today's discussion and making sure the conference provides clear guidance. I would also like to extend my thanks and appreciation to the Bureau and officials of the senior official segment. They ably steered the discussions during the first 3 days of the conference. I am confident that the impact of this conference will resonate across Asia and the Pacific. ESCAP, along with the 12 organizers or co-organizers of the Ministerial Conference and our development partners, is committed to supporting the Commission's members and associate members in their endeavor to improve their civil registration and vital statistics system. By working together under the Regional Action Framework for Civil Registration and Vital Statistics, we can realize our shared vision. Thank you very much.
Thank you for your remarks, Madam Executive Secretary. Ladies and gentlemen, excellencies, distinguished colleagues, I would like to thank all of you for the thoughtful deliberations we have enjoyed over the last few days to provide guidance as we look towards the second half of the Asian and Pacific Civil Registration and Vital Statistics decade. During our discussions, we have identified and outlined potential solutions to the challenges faced by civil registration and vital statistics systems in the region, with consideration for the instrumental role that they play in achieving the goals and targets of the 2030 Agenda for Sustainable Development. Although we are on the right track to achieve the goals of the Regional Action Framework, accelerated efforts are needed in many areas, most notably for death registration, including on reporting of cause of death, as well as the production of accurate, complete, and timely vital statistics based on registration records. The importance of civil registration and vital statistics for gender across the life courses has been highlighted, with stark deficiencies in the registration of marriages and divorces and a particular gap. It has also been well noted that despite the significant progress made across the Asian and the Pacific region, it is often the poorest and most vulnerable people who are still being left behind, and therefore it is imperative that we scale up the use of inequality assessment to truly get everyone in the picture. Considering the significant progress that has been made by countries in the region in just half a decade, it is not whimsical fancy but an achievable, albeit ambitious, prospect that by 2024 we can realize the shared vision that all people in Asia and the Pacific will benefit from a universal and responsive civil registration and vital statistics system. But it is clear we need to accelerate progress, and it is now in our collective hands to do so. I would like to thank the chair of the Ministerial segment, His Excellency Dr. Faisal Sultan, Special Assistant to the Prime Minister and National Health Services Regulations and Coordination of Pakistan, for launching today's discussions, as well as the chair and vice chairs of the senior official segment for moderating the 3 days of the conference. I would also like to thank you, Ms. Armida Salsiah Alisjahbana, and your staff for the effective servicing of this conference. I would also like to thank other organizers of the conference: UNICEF, UNDP, UNHCR, UNFPA, UN Women, World Bank, WHO, Pacific Community, CDC Foundation, Vital Strategies, Plan International, and the World Vision, for their excellent collaboration and the successful organization of the conference. Indeed, I would like at this point to recognize all those from the Secretariat and other development partners who work behind the scenes to make this conference a productive and memorable one. Excellencies, distinguished delegates, with that, I thank all delegations for the participation and look forward to meeting you again in person. Before ending this session, I am delighted to share with you a video made by the Secretary for the closing of this conference. I would like to request the conference room officer to play the video after the session is concluded. I hereby declare the Second Ministerial Conference on Civil Registration and Vital Statistics in Asia and the Pacific is adjourned.
We are here to celebrate reaching the midpoint of the Asia and Pacific Civil Registration and Vital Statistics decade. We will reflect not only on our accomplishments, but also on areas to redouble our collective efforts. Our work is not yet over.
Lao PDR will try to meet its target for birth registration and certification of at least 70%.
Armenia expresses its commitment to continue the enhancement of the CRVS and national ID management systems, thereby providing every child with a birth certificate and every person with an identification document.
Hard to reach population groups and people in vulnerable situations face challenges when they try to get access to national registration. From the perspective of the United Nations Refugee Agency, one of the greatest challenges remains birth registration for refugee children and for stateless children.
It's very much related to human rights. All of this, when you are talking about birth registration, when you are talking about registration, death certificate or marriage certificate, this is very basic human rights.
The COVID-19 pandemic has highlighted remaining gaps in our civil registration and vital statistics systems, especially with regard to mortality. If we do not register all deaths, how can we really know the true impact of the pandemic in Asia and the Pacific?
It is essential that we learn from each other to make sure we accelerate progress towards the 3 goals of the decade: universal civil registration, the provision of legal documentation of civil registration for all, and the use of civil registration records for vital statistics.
Data helps leaders better understand the problems they face and how to solve them. Over the past 2 years, the pandemic has highlighted just how critical following the data is.
As enshrined in Article 6 of the Universal Declaration on Human Rights, everyone has the right to be recognized as a person before the law. A legal identity for all is central to delivering on the Sustainable Development Goals and building a safer, more peaceful and resilient world.
But we are not at the finish line yet. We have identified the gaps, issues, or areas that need more work to be done to achieve the agreed goals.
Health systems in every country has been tested. No country was prepared. For us to be better prepared, respond, and recover, we must invest in civil registration and vital statistics today so that every country has a robust health information system in the future.